recording cloud. Hello, everybody. We are again here together with the last part of our conference on Api therapy, beehive products in microbiology. And we'll have some kind of synthesis presentations on Bivanomi therapy and also another one on general rules and principles. And then we'll have Dr. Elbens Azevedo from Canada, who will present a very, very interesting use of beehive products against gynecological diseases. Okay, so let me share the screen and I'll start with the first presentation, which is on Venom. Okay, let's close this one and then let's take this one. Okay, so Venom used against infectious diseases. Let me try to do this from the beginning. Yes, it's working. And okay. So it's a very, very short review on the use of Venom against infectious disease against bacteria. I will present just some elements. So first of all, we know that about a few ideas about the history. So the bees are attacking their enemies, mice, other insects, mammals, animals, bears, and so on. And sometimes when these small animals are entering into their hive, they are propolising them inside the beehive. But before they are stinging them. So when you sting an enemy, Venom itself, it's antibacterial. So it helps against the putrefaction of that enemy inside the beehive. Then another very interesting related also to history, it's leprosy in Africa. I hope our friends from Kenya, from other African countries will confirm this. I know for a long time, Pygmies tribes in Africa, when they have leprosy, an onset of leprosy, they use bee stings. Maybe not all tribes, but some of them, yes, and this information arrived also to Europe. Lyme disease, it's known, the fight of Venom against Lyme disease for a long time. There are studies like in 1997, Lupke and Garrett showed that Venom, especially melittin, can spread very quickly in Borrelia. And also there are more recent studies in 2017 in Canada. One researcher found out that Venom is very good against Lyme. Not Canada, it's United States, sorry. Labial herpes, zona zoster, AIDS, and so on. So let me show you some photos. This is about bee stings against leprosy used in Africa by the Pygmies. Bee venom, it's antibacterial, but also against the bacteria which are causing leprosy or, for example, tuberculosis. They are like similar kind of microorganisms. Then one idea here about the use of bee venom against many viruses. It is a synthesis made in Iran by Meriani. And you see here melittin, which is the most important component from bee venom. It's inactivating various different viruses. And all these viruses, of course, are causing infectious diseases. Herpes simplex, vesicular stomatitis virus, Coxsackie virus, enterovirus, about the gastroenteritis, viral gastroenteritis, and so on, and including HIV. This is very, very interesting. We saw this morning the presentation of Professor Biagi from Italy. He used propolis and extracts of medicinal plants against HIV. But also you can see we can use also bee venom. And we need to go a bit to the theory. Major causes of the infectious diseases are either the agent, infectious agent, is stronger than the body, like in the case of Ebola, or strong neutral or even weak infectious agent, like a small flu virus, but weak or very weak immune system. And we have this example also with COVID-19. The virus of COVID, SARS-CoV-2 is not a dangerous virus if you look to the virulence and so on, but it attacks those human beings which have a very weak immune system or a weak body. Okay, so as I said, stronger than the body infectious agent can be like Ebola virus, HIV, poliovirus, and so on. And here it's when the immune system is too weak. And this is the major cause of infectious diseases, in my opinion, in 99% of the cases. It's not the agent. So we are focusing on the agent, on the bacteria, virus, fungus, parasite, and so on, which is very good. But much, much more important is the immune system. And if we look to the causes of a low immune system, we may find this kind of causes, like poor diet, fatigue, advanced age, biological age, because chronological age may be big, but biological age may be younger, poor blood flow. But there are not only these causes which are attacking the immune system, of course. There are other ones like stress, free radical, coldness, dehydration, internal and external pollution, like somebody having constipation will have a lot of toxins inside, sleep disorders, poor regeneration. And if we go in more detail, we find other causes like capillary fragility, which is one of the major causes of infectious diseases. When the external skin and the internal skins like mucosas are weak, and even the capillaries, the arterioles are weak, then the aggressive pathogenic microorganisms can penetrate faster inside. And the big problem with these causes of the low immune system is that they are not staying just alone, separate, like in their own areas. They are cooperating together to attack the immune system. Cooperating, or maybe it's too strong says cooperating, but they are working against our body, against our health by cooperating among them. For example, a poor capillary fragility will create a poor blood flow and vice versa. Poor diet, like lack of vitamin C, will make the capillaries weaker. Fatigue is related to coldness. Excessive coldness will create also fatigue. Dehydration creates or helps the sleep disorders, or dehydration also allows too much internal or internal pollution, like the toxins in the body becomes too concentrated, and so on and so on. And if you see this kind of cooperation, it's not only at this, like some of them are cooperating with some of them, but all of them are cooperating with all of them. So they are really very aggressive when they are not kept under control. So a good doctor needs to have enough patience and go step by step, cause by cause, and neutralize all these causes, or eliminate all the causes or neutralize them. Advanced age, of course, you cannot eliminate, but you can, in a sense, you can neutralize it by giving to that person rejuvenating methods like bee pollen, royal jelly, bee bread, and so on. Okay, so keep in mind that we need to eliminate all these causes and not only some of them. Classical medicine, it goes for destroying the virus, like for example in this COVID-19 story, like in the first years they said only virus is important. And they said only vaccine is important. And they spoke very seldom about comorbidities or other causes, which is very, very bad. Okay, one of these important causes of the immune system, as I told you, is this capillary or arteriolar fragility. And this is given by lack of vitamin C, lack of polyphenols are the major causes. And you cannot eliminate this cause with vaccines or with chemical drugs, with antivirals, antibiotics, and so on, because it's an internal cause at the cellular and tisular level. Okay, so let's look a bit to the mechanism of actions of bee venom. There are direct mechanisms and indirect mechanisms. So let's go for the direct mechanisms, how the venom attacks these components. There are, of course, many methods. If you look in the internet, you go for melitine, and you put melitine as in the search area, and you put viruses, you'll find many such mechanisms of action. Some of them are like this one, destruction by melitine and phospholipase A2 of other outer membrane shell of the pathogenic microorganism, just the destruction of the membranes. Okay. Also, another one, it's blocking the pathogenic microorganism replication. So the multiplication or replication of that microorganism is blocked by bee venom. And here is one reference which shows that, very interestingly, the venom induces pores into the membranes of the pathogenic microorganism. But it's very interesting, it doesn't affect our own cells. The healthy cells are not affected by the melitine, only if it's a real local effect when we make the injection or we make the bee sting. But after the venom or melitine is diluted in the body, we do not have any more this kind of attacking of the membranes. On the contrary. And then the big mechanism of action of bee venom, more important than the ones I told you, antibacterial or antiparasitic and so on, it's immune system activation, and it induces or helps the local or general fever in a biochemical way. So bee venom, it's a biochemical combination. So when you get these things, you feel hot, you feel heat, not only locally, but also all over the body. And this is similar with the fever. And remember that fever is one of the major biological mechanisms of defense of the body, used not only by the human beings, by all living beings on Earth, even by fish in the water. With the fish in the water and has an infection, it stimulates, it creates fever. Because fever activates the blood flow in the immune system and so on. Okay, so bee venom, it's useful because it activates the blood flow, the immune system, and all the cells in the body are stimulated. The blood flows better in the heart, in the brain, and there are on top of this direct antiviral, antimycotic, antibacterial, and antifungal effect of bee venom. Okay, so, and another indirect mechanism is the useful initial inflammation. The bee venom at the beginning creates an inflammation, but afterwards the body reacts, and it reacts with anti-inflammatory kind of reactions. And as I said, improved blood flow. And the initial inflammation after one pathogenic microorganism enter into the body, for example, in the nose, a virus, and creates rhinorrhea or inflammation in the nose, this is a normal, good, healthy reaction, because the local tissue starts the fight against this enemy. Okay, so also another mechanism of action of the venom, it decreases the comorbidities. So the risks of obesity, of heart and cardiovascular disorders, and so on. And it fights many other, like we have one pathogenic microorganism which enter in our body, like SARS-CoV-2 or herpes virus or malaria. But the problem is when that patient has also many other co-infections. So you cannot use 20 different chemical drugs against 20 different co-infections, but you can use a combination of bee products to fight all of these co-infections, almost all of them, let's say. Another mechanism of action of bee venom is hypoanalgesic, which means that it diminishes the pain in a, let's say, natural way. And remember that with infections, diseases, we have almost always inflammations, and inflammation comes always with pain, a form or other of pains. But bee venom, it's extraordinary as a painkiller. And most of the patients with infectious disease, they have depression. They are scared that they will die and so on. And the bee venom, it's antidepressive. It's not only bee venom, but also we can use propolis, it's antidepressant, bee pollen, royal jelly too. So we can use in synergy. Short example of use of bee venom against infectious disease, as I said, Lyme disease. can benefit. There are many reports by people which have had Lyme disease for many years, and when they were attacked, stung accidentally by many bees, they got healed. And as I said, there are already scientific documents which proves this. Zona zoster, labial herpes and zona zoster. Let me give you my own example. I have had many years herpes. Every year before the big congress we organized in Germany, because of the stress, my immune system went down, and I was always having have had herpes, labial herpes. But one friend of ours from Portugal, Antonio Couto, at one of our congresses in Bucharest in 2012, he came and he did to me and to one other colleague from Romania a microbisting directly on the herpes. And since then, personally, so there are already 10 years, I have never had back any herpes. So it's in my case, at least, it was like a cure for the rest of my life. Dental abscess, vesicular stomatitis. One example with dental abscess, we can use Bivanomi on the abscess area here directly, or micro sting like this one, or even direct sting. And we have a colleague in Romania, Dr. George Cleanu, who has treated his father having abscess in two periods of time, very successfully. The inflammation went down in about 1 hour. Extremely fast efficiency of Bivanomi, because Bivanomi, it's directly antibacterial, but also it's indirectly anti-inflammatory. AIDS, malaria, tuberculosis. There are several reports of the use of Bivanomi against AIDS, and against malaria too, against tuberculosis. Of course, you need a very complex treatment protocol to adapt to the individual needs of every person. Influenza, viral enteritis too. Pilonidal cysts. I have here a few images from Mexico, one case. In Mexico, there are many apitherapy practitioners. They are using a lot of Bivanomi. And here is one case with one patient having here an infection, like a infected area with bacteria under the skin. It was a Pilonidal cyst, which is under the skin. It's like a hair. The hair follicle inside was infected, and they put these things around the infected area. You see here, if you look carefully, it's a stinger, bee stinger all around this area. And after a couple of treatments, you see here the abscess was going out, and then the therapist took out the infected hair, just like this. And then he continued with the bee stings. You see here the bee stings, the stinger around, until complete cure. So it's possible to use also Bivanomi against infectious disease, localized infectious disease, like in this case on the skin. Here is another example with superficial gangrene. We used, it was a case in Romania. We used a special recipe with best antibacterial honey, best propolis extract, best essential oil, but also these things were used on the lower back and on the calves to improve the blood flow, to work in synergy with the other ingredients. Okay, so a few information about the Bivanomi products, where you can find some of the best Bivanomi products. Of course, you can ask your local beekeepers who is producing Bivanomi or collecting Bivanomi in a very high quality. Here is one example from Argentina. It's a homeopathical dilution. Here is from Romania, injectable solution. Both are sterile, of course, and you can use it for a long time. So, for example, here the concentration is 2 milligrams per milliliter, which means for each milliliter of this solution, you get the equivalent of 20 bee stings. And this is good because you have a clear, standardized product and you know how to use it in the practice. It's another example here from Uruguay, from Dr. Eduardo Lema. He has a big company there, Api-Pharma, and they are selling for over 20 years, I believe now, Bivanomi in tablets form, sublingual, with the same indications like for Bivanomi, including anti-infectious, but with no risks of allergies or pains and so on, like when it's the case with injections or with bee stings. Another very, very practical use of Bivanomi is to mix in honey. And here is one example from, I believe it's in New Zealand, Bivanomi Honey. And there are several countries, several companies which are selling this kind of mixture in UK, in Canada, and so on. So it's good to take internally. So like you take 1 teaspoon, 2-3 times per day, you keep it under the tongue as long as possible. Then you'll get some of the molecules from Bivenom inside the body. And the dangerous substances from Bivenom, which are hyaluronidase A2 and hyaluronidase and phospholipase A2, they are destroyed by the gastric juice, by the enzymes in the stomach, like pepsin and pepsinogen. Okay, so if you want more practical information on how to use Bivenom, join your local, regional, national, or international epitherapy societies, groups, networks. And you saw that we have in WhatsApp several such groups, apitherapy groups. If you don't know about them, just send us a message and we'll connect you with these groups. Or why not come to Romania, which I consider the apitherapy land. It's most probably the most advanced country in the world with apitherapy, especially for the clinical part, the practical part. So you don't know where is Romania? Let's see. So Romania, it's on planet Earth. It's on Europe. And it's near the Black Sea. And here is Bucharest, the capital city of Romania. And here is my small house with the apitherapy center connected here, everything inside. And we have a lot of medicinal plants. And I thank you for your attention for this first presentation. And let me do quickly the next presentation, and then we go for questions and comments and so on. So, rules and principles on the clinical use of beehive products against infectious diseases. First of all, we must study and look to the human being and its problems, to the pathogenic microorganisms, and to the bee products' composition and useful properties. So, of course, we need to know very well how the body is functioning, and if the body has a weak structure, weak body structure, genetically induced or acquired during the lifetime. For example, somebody drinking too much alcohol or smoking or eating very bad will have a weak body structure. So it will be much more attacked by the pathogenic microorganisms. Or the immune system is very weak, but the weak structure and weak functioning of the immune system depends on all the other organs in the body. So you'll see you need very good cooperation among all the organs of the body to make a strong immune system. Again, this list of causes and how the causes, they are interacting themselves. So you need to eliminate this if you want a strong immune system. You must eliminate the comorbidities. Like I told you before, capillary fragility, it's only one of the causes of the comorbidities, but also obesity, it's a very bad one. Diabetes, it's another very bad one. We know that people with diabetes have all kinds of infections, for example, fungal infections here on the lower, on the toes, and they get infected wounds and so on and so on. And they get also much more severe cases of COVID-19 or viral conditions and so on. We need to keep under control, as I said before, all the co-infections in the body. There are many different co-infections. So usually a patient is attacked by one of these microorganisms, not by all of them, but sometimes it's one of them, but the other ones are like in the background, still there and still causing problems. Okay, so before we go to the treatment protocol, the first thing is to have a complete diagnostic at all levels, physical, structural, material diagnostic. And this one is very well done by the classical doctors, by the allopathic doctors from the modern hospitals. They are very good to tell you you have a lack of substance in this or this organ, like osteoporosis, or you have too much substance, like, for example, a cancer, or too much fats in the liver, and so on and so on. So we need this first diagnosis from the allopathic doctors. Then we need functional, energetical, or related to metabolism kind of diagnosis. And for this one, the best are the specialists in acupuncture and Ayurveda, because they look much better on the energetical part of the body, on the functioning, than the classical doctors. Then we need psycho-emotional diagnosis made by a good psychotherapist, because we know already the Chinese are saying for 3,000 years that most of the internal diseases, most of the internal weaknesses comes from problems on the psycho-emotional level. So if we have, for example, too much worries, we will attack our pancreas and the stomach, that the nutrition doesn't go very well. We have too much anger, we affect our liver through the gallbladder, and then the liver cannot do the work of regeneration of the body, including of the immune system, cannot help, and so on and so on. And you need also a diagnosis at spiritual level, because there are things very deep in our being which may be wrong. So you need to correct this with appropriate measures. Okay, so after we got the diagnosis at all levels of the body, and again, do not say just tuberculosis, do not say just malaria or AIDS and so on. This is a very localized diagnostic. It's good to start, but you need, again, the diagnostic on all other levels, because if you have the diagnostic on all other levels, you will be able to make a complete list with all the causes of the causes of the causes of the causes and so on of this disease or this problem in this person. Okay, so do not go just for the superficial causes, for the symptoms and signs, go for the deep causes. And then only then you should go and study more the pathogenic microorganisms. Of course, like in the case of the study of our own human body, you need to go for the diagnose, let's say, the structure, the anatomy, the histology of this microorganism, the structure and their functioning. So we need to see how these microorganisms are attacking our body. What is their modus operandi? How virulent are they? And what are their weak spots? Because every living being has some weak spots, because otherwise they will survive forever. They will conquer the whole earth. So every living being, including us, they have some weak spots. So if we know the weak spots, then we know how to attack them. Okay, so then you go for the bee products. What bee products are best against what pathogenic microorganism? And then you have one option. You go to the literature and you say, okay, I have this virus. Then I go into the literature. Okay, what bee product can destroy this virus? And you go for the database, for example, on bee venom. And you'll find that bee venom can attack and destroy this virus. Or you go to other articles and you'll find that propolis is very good for such a thing. And by the way, I didn't put in this PowerPoint, but due to this COVID-19, I made a special web page in my website in apitherapy.com. I named it Virology, and there are over 100 studies, scientific studies, on the use of beehive products against viruses. So it's 100 studies only for the viruses. But if you look for the other ones, there are thousands of such studies which confirm that the bee products can neutralize, destroy, or eliminate the pathogenic microorganisms. So what is the beautiful part of the action of the beehive products against this microorganism is that they are attacking the microorganisms through multiple mechanisms. Not only one mechanism. It's not like the antibiotics, which are using only one mechanism, only one substance, which is a huge error from the pharma industry. They are working against this pathogenic microorganism with multiple substances and multiple mechanisms. And they are doing this for millions of years. Let's keep in mind that the bees are having inside their colonies, they have very good food, good humidity, so enough water, good temperature, which is perfect for the development of bacteria, but they are keeping this bacteria under control for millions of years. Okay, so if we have enough patience and we have enough knowledge, we have enough experience exchange with our colleagues, you'll see that almost all causes of the causes mentioned before can be neutralized by the beehive products or by the substance which you can find around the beehives in the nature, like medicinal plants, essential oils, good food, and so on. Okay, so let's see one example here of apitherapy against the virus. Because we have been on COVID-19, I'll go quickly through these slides. So first thing is, of course, you can try to destroy bad microorganisms before it enters the body, and how to destroy before entering the body. And there are several like physical methods, let's say mechanical methods, like air ventilation. You just dilute that pathogen. Like in our body, if the pathogen enters into the body, you need to drink more water, more liquids, and this will help the dilution of that pathogen. Also expose the pathogen to the direct sunlight, because sunlight ultraviolets can destroy the viruses and bacteria from the air. Once they are inside, it's not anymore possible, but in the air can be like sterilized by the sunlight. So open your windows largely to allow the sunlight to come inside. Also exposure to ultraviolet lamps, like in the surgery rooms, is made this all over the world. Also heat, it's a very good way to destroy the microorganisms, pathogenic microorganisms, because the temperature over 45-50 degrees Celsius already denaturate the viral proteins or the proteins from the pathogenic organisms. Air purifying devices, this is also possible, but this is not a solution on a long term, because the people cannot live in a confined environment, blocked, isolated. They must go out. So, but it's a good solution for a short term. Then very, very good in apitherapy, we are using the so-called propolizers, which are using two things, propolis and the heat. And with heat, like created by electrical devices, like here you see from Italy or from Slovenia, propolis with the heat at about 80 degrees Celsius becomes liquid. And then the volatiles from propolis goes out very easy. And then we can just inhale these volatiles from the propolis. And you see here the example from Slovenia. You can put this kind of devices in the living room or in the bedroom. It's very good. You put it on a small chair here near where you sleep. And then you'll get all the night good benefits. The other one is very, very good. I told you before in other presentation, it's used like this device you put in the car, and you create like a sauna inside the car, and this helps also against the viruses. This one is the device from Slovenia. I told you Propostim. You can Google in internet Propostim, and you will see they have this device, and you can put here large amounts of propolis in this how do you call this, like this plate, and then this creates the heat, and the heat again evaporates the volatiles from the propolis in a very intensive manner. Okay, again, you can put in living room and bedroom. Then there are chemical methods that are used by the normal medical doctors, normal infectionists, like soap, disinfectants, and so on. But when I hear about chemical methods, like direct chemical methods, when I look to these people here having this protection of their own body against these chemicals, I'm not smiling, I'm not very happy. So it's much better to use biochemical methods that do not hurt the body structure and its healing powers, like beehive products, medicinal plants, essential oils, a healthy diet, and so on. And here is one example of a propolized cabin, like in your home, you can make such a thing, or in your clinic, you just make a small house in wood, like this is 3 meters per 3 meter, something like this. And then inside you can put these propolizers, and the people can breathe inside these propolis volatiles. Again, this propolizer you can use anytime you work or when you need it. And now when we go with the treatment protocols, of course, we need to go for the symptoms, signs, and the pathogenesis of that microorganism, which attacks our body. And then depending on these symptoms, signs, and pathogenesis, like how the virus or that microorganism attacks the body inside, we make our treatment protocol. Here, for example, this kind of virus can create these kind of symptoms, and we need to go also for the symptoms and neutralize them. And simultaneously, we must go to the enemy, which is the virus in this case. So how does the virus enter into the body? Mainly through the nose. So we must protect the nose against these problems. And we can give in apitherapy honey and propolis as nasal drops. And it works wonderful. Idea is to put before you are exposed potentially to viruses. Then we can use also nasal sprays, which are also very practical. You can buy from pharmacies or in internet this kind of container. And then you make your own preparation with propolis extracts, like water propolis extract. Of course, alcohol extract doesn't go here because it's very, very painful. And it dries the skin mucosa in the nose, and this is not good, the mucosa, nasal mucosa. This one is another method, very interesting from Ecuador. This therapist, Sandra Mercado, is using the masks, classical masks, but she puts on the mask directly propolis. So you have the mask which protects physically against the penetration of the virus or the spores and so on. And also you have the propolis with essential oils, which are antibacterial, antiviral, and so on. And also they help the immune system. By the way, all surgeons, before they are entering into the operation room, they should use also propolis on their breathing masks. Here it's an adaptation of this idea. Somebody from Russia came with the idea to put inside the mask, to create a mask with double layer, and to put inside raw propolis, which is fresh, of course. A very fresh propolis is more volatile, more active. And like we have our dear Professor Mamdouh Abdulrahman from Egypt, we listened to his presentation this morning. You can even adapt the mask. You can put here raw propolis, very, very fresh, in a sachet like this one with many small holes to allow the elimination of the volatiles. Of course, a good technician can create several such devices, let's say. Then when the virus attacks the brain, it can cause headache, and of course you can use here all of the products through the mouth, oral administration, respiratory administration, suppository, and so on, to come through the blood to the brain. And another possible symptom is on the eyes, when the virus goes directly on the eyes and it creates conjunctivitis. In this situation, we can use various products. Honey, for example, you put first honey on the outer eyelids, and then step by step you can put it diluted also in the conjunctival sac here, or even pure honey sometimes. And also you can use water propolis extract, royal jelly. It's used also in Lithuania a lot, royal jelly preparations, eye drops, and so on. So practically you can use the soft bee products to eliminate this viral conjunctivitis with eye drops. It's maybe not so easy, but with a good pharmacist, you can create such preparations, or you can speak with a big company which is already doing eye drops, and you can give them the formula, and you can create new eye drops with honey, royal jelly, and or propolis. Some people, they have problems when the virus enters into the mouth mucosa, like on the tongue, they lose the taste, or they have other problems. So here it's easy to use the bee products because you can act locally. Honey, propolis, royal jelly will act quickly locally. If the virus attacks the pharynx, then we can use, again, sprays with honey and propolis, gargle, and so on. It's also a very easy to access area from outside. It's not deep in the body. If the virus enters deeper and attacks the trachea and we have coughing, then we can use, again, bee products to activate also the elimination of the mucus. Coughing, by the way, as Professor Mamdouh said, it's very good reaction of the body. It's a healthy reaction of the body because the body wants to eliminate mechanically the virus out. Of course, when it's excessive, really excessive, it may be not so good, but you can calm down by helping these cells to eliminate the virus and the particles from the lungs. And this kind of activation and help is done very well by honey and by propolis. So this is the drawing we should all keep in mind. The people which are smoking, for example, they inhale the bad particles, viruses, and so on. But if we give the bee products, we can help the elimination of this one. And the best ones, some of the best ones are linden honey and linden flowers. As this one is a tea, and this one honey in the tea, or also through nebulizations or inhalations and so on. And we can add also some propolis extracts to this preparation to accelerate the healing. Okay, also we can use herbal remedies against dry cough, like licorice, turmeric, and so on. And now, if the virus enters very, very deep into the lungs, like at the level of alveoli, then the patients may have dyspnea, chills, fever. Then later on, it goes into the body. But at the beginning, the first phase here is like viral pneumonia, which can turn to bacterial pneumonia. The patient may have microthrombosis in the lung, and of course, lack of oxygen. So in this situation, what shall we do against dyspnea? Apitherapy against dyspnea. One of the ways is to use Bivanomi honey and propolis, the Bivanomi cream form, because it's already an advanced stage. But honey we can use through nebulization, through inhalations, propolis also. And there are acupuncture points very good, which you can stimulate with a Bivanomi cream. Like you see here, these acupuncture points. Let me show you some of them, like covering vessel 25, which is bronchodilatory. It's known in Chinese medicine for thousands of years. And then this one here, it's governing vessel, Zhenzhong. It's also bronchodilatory, but also cardiostimulative. Here, gallbladder 20, Feng Qi, it's here on the back. It's also very good. And also we can use these two other points, which helps the lungs functioning. And here it's another one for the breathing altogether. And this one, it's against the laryngeal spasm. Sometimes may happen such a problem. Okay, and then here it's another point which acts on the lungs, urinary bladder 13. And this one is very good for adrenal glands to activate the survival mechanisms. And we have also acupuncture points, micro acupuncture points on the ears. And we can stimulate them with the Bivanomi cream, or a good therapist, apitherapist can use even micro bistings. Okay, and of course we can use nebulization. As I said, this is very, very soft, very practical, and very easy. Everybody can do this in very, very easy. Just you need from the pharmacy a nebulizer and a good, healthy, and clean medicinal honey or a good propolis. Okay, so if the chills are present and the patients with infections with pathogenic microorganisms, they have at the beginning chills, and this is again a very good reaction of the body because the body needs heat. That's why we go in the bed, we cover our body, we use this kind of protection against the cold here on the head, and we need a lot of heat. So the body will create the fever biologically, but it must add also this fever by drinking a lot of warm liquids, like liquids at 42 degrees Celsius. A lot of soups, teas, and even warm water will help. And the chill, once the body has activated this mechanism, fever will come, and fever is extremely, extremely useful. And it should not be blocked. Heat and fever are extremely important, and it's our friend, is not our enemy. And I give you just only one argument. There is one paper here published in 2015 by a group of Americans, and they show there that fever, if it's diminished too soon, if it's decreased by chemical methods like antipyretics, like paracetamol and all these kind of chemical drugs, this attacks the immune system. This makes the immune system weak. This attacks the liver and so on and so on. And this is very important, allows bacteria and viruses to survive. And this can increase the risk of death. If you come with an antipyretic at the beginning of an infectious disease, when the body started the fight against that pathogenic microorganism, it's like you are killing your the healing methods and the weapons, the biological weapons of the body, by blocking them. So if you block this inside immune system mechanism, then the virus and bacteria, of course, will multiply and the risk of death increases. So it's statistically proven, if you decrease the fever too soon, you increase the mortality risk. So it's not a joke. Fever, it's our friend. You need to speak with the specialist and see how you can keep the fever under control. Only when the fever is very high, like giving convulsions, or giving headaches, or giving confusion, mental confusion, and so on, you must diminish it, of course, but not with chemical drugs, but with physical methods, like drinking more water, like putting water on the body, and so on and so on. Okay, so this is the article. I advise you to search this article and to convince yourself that fever is our friend, it's not our enemy. Okay, now at the end of my presentation, it's a bit funny kind of correlation, but if the bacteria or this pathogenic microorganism would be a terrorist, would you use against this terrorist only one weapon? Would you use only one molecule like an antibiotic or an antiviral? Or will you use a lot of different components which are fighting against that enemy? So practically, to fight the terrorist, the microorganism kind of terrorist with an antibiotic, it's like this guy trying to fight the terrorist with just a bow like this one. So it's a huge mistake, and I really do not understand why the pharma industry and even like 95% of the infectionist doctors, they are still going for antibiotics. Because it's a lost battle from the very beginning. Because the microorganisms, they find many ways to fight back the antibiotics. They create enzymes which attacks the antibiotic and so on and so on. So it's much more intelligent to use the nature's intelligence, which nature uses this antibacterial mechanism for millions of years, which is like in the war. Like it's the war now in Ukraine. The Ukrainians are helped by the Americans, by many other countries, with multiple weapons to attack the enemies. And the same we should do in our medicine in the case of infectious disease in human beings, which means that we need to use many classes of different substances to attack this pathogenic microorganism, and not only one of them. And it's interesting, Mother Nature changes from year to year. For example, the flavonoids, if you like the research proved, the poplars changes their cocktail of substances from year to year, from season to season, adapting, creating new cocktails, new mixtures, and thus the bacteria cannot adapt even to multiple weapons, because the thinking would be, okay, microorganisms are also important for the balance of life on Earth. So maybe they find some methods to fight against these multiple enemies. But if you change the formula of these enemies from time to time, then it's difficult for the bacteria to make genetical changes inside and communicate among themselves, like in the case of biofilm, and fight. Okay, so here another like synthetic kind of drawing. Propolis here, but all the products that have simultaneous useful properties, like propolis has over 70 such useful properties. Same for honey, for propolis, for algae, for Bivanomi, and so on. So it's not like only one substance from pharma industry, which has, for example, one antiviral effect maybe, or it's antibacterial like an antibiotic or antiparasitary. But we have products which are having simultaneous many good effects. So conclusion of my presentation: to obtain fast and good results in our practice, we need to ensure the following conditions related to the bee products. So perfect quality, fresh, correctly used, extracted and processed, perfect quantity too, quality and quantity. We need adapted pharmaceutical forms, like for every single disease, for every single patient, we need different kind of preparations and products to be very specific to the situation. And here is a very important golden rule in apitherapy, which is administration of the bee products through all anatomical ways. If you administer the product only orally or only sublingual, and you do not use the other ways, like respiratory, you are wasting a lot of time, and the patient may die in the next days or weeks. So you must go to the target. Let's say the target is the lungs. You go through all anatomical ways. You come from the blood direction, from the air direction. If you swallow a product like here orally, honey or propolis or royal jelly, this will come to the liver, and it will through the portal vein, and then it will be blocked more or less in the liver, so it will not reach the target. But if you use other entrances in the body, like suppositories or even intravenous sometimes, and remember, Professor Mabduc said also this morning, he confirmed the use of honey intravenous. We can use also propolis water extract intravenous. Bivanomi was already used intravenous. So again, the big rule is to use all anatomical ways. Okay, at the right time. And here is about the chronology, the biorhythms, when to administer the products, how often in a day. The general rule is that when the disease is not so severe, you administer the product 1 to 3 times per day. But if it's more severe, you administer the same products 6 times per day or 10 times per day or almost every hour, or you just administer it through perfusion, like here in perfusion, non-stop perfusion. So it depends on the severity. And you need to use all these products, all these wonderful bee products, until complete cure or clear improvement. So do not stop the treatment. Like Professor Mamdouh said, when sometimes the patient gets some like healing crisis, they get an aggravation of their symptoms and they quit the treatment. It's a mistake. You need to stay with this treatment until the specialist will say, now the patient is healed. And then here is the beauty of this method is that you must not go back to zero with your doses. You remain on a preventative dose to prevent other diseases. And here is another beauty of apitherapy. We use the bee products from here, from this part to here until the healing. We use them as remedies, as functional foods, as natural remedies. But from here ongoing, we use the bee products as foods or as, again, functional foods, but mainly as food. So if we feed the body with this bee product or inhale the good substances, the disease will not come back so easy. Nutrition is of paramount important, because nutrition, when the nutrition is wrong, all the immune system and all the cells of the body goes bad. For example, in COVID-19 studies showed, and not only COVID-19, even in 1918, during the Spanish flu, they proved that the vegetarians have less problems with infectious diseases than the people which are eating kind of McDonald's. And now very shortly, the do's and don'ts in apitherapy against infectious diseases. First, bee products quality. Here are some details. So do not expose the bee products to the sunlight, to the heat, to the pollutants. The beekeeper should not use the smoker so much as less as possible. Take care about the parasites in the bee colony, possibly like varroa, because varroa then needs sometimes chemical drugs. And keep under control the bacterial load in the bee products too. And live in a clean environment, far away from cities and pollution. So do not stay in polluted areas. Put in your garden a lot of medicinal bee plants, especially aromatic plants. Do not stay in such places. Go away, sell your house, sell your property, and go for the natural environment. If you are a beekeeper, take care that the bees are very strong, very healthy, and they do not have diseases. Okay, and here it's an important, very important one. If you want to be on top of the situation, always work with the local medical doctors, ideally the ones specialized in microbiology, infectious diseases, pneumology, otorhinolaryngology, immunology, and do not work alone. There are some people, even some therapists, they say, I'm the best in the world. I do not need specialists. I do not need modern medicine. I work alone. So this is a mistake, of course. So also you need to get a lot of information through courses, workshops, reading scientific articles, stay in touch with us, with our group. We have a lot of information on how to fight infectious diseases, as you saw in these days. And again, do not stay at the ignorance side. Here is one problem. Unfortunately, many medical doctors, they have their head full of information from the pharma industry, and they do not have any more place for natural therapies, which is pretty bad. So they need to make some place to accept other therapies too. Okay, and then last one here is to get all the licenses you need to practice apitherapy from your local authorities. You need to check with your government. Can you practice apitherapy in your country? Can you pay your taxes and so on? And of course, the mistake is to work alone with no licensing. Final conclusions, we need the D'Artagnan principle, which is one for all and all for one. The body needs all the bee products, needs all the organs in good shape. And the beehive products are really excellent protectors and excellent biological bodyguards for our body. And thank you very much for your attention. We can send you bibliography and you can contact us also by this WhatsApp. And keep in mind, you can join also later our International Federation of Apitherapy, apithera.org, with your association, national association, or as a physical person. Okay, so these were my presentations. Oh, and I'm very, very happy to see here Dr. Elbens Azevedo from Canada. Hello, Dr. Azevedo. Wonderful, wonderful. Okay, so let me check in the program. Okay, so yes, so we are pretty well in the program, and I kindly ask the participants. Oh yes, we have a question from Sibel Silici. Let me allow you to unmute yourself. Okay. Yes, Sibel, you can activate it. Also your camera, video camera, if you have.
Yes, of course. Thank you very much for your nice, interesting and presentation, and you summarized all of the products and pharmacological activities and etc. Thank you very much, really. I have a question, please. Which liquid is good to store bee venom, fresh bee venom?
Okay, so first of all, the fresh bee venom, after it's collected by the beekeepers, it's dried. And it stays dried, and you put it in a container, like brown color container, glass, under vacuum maybe. This is one of the options. The other option is, like we have in Romania, you put in a saline solution. So you can put it in distilled water. It must be, of course, a sterile solution, okay? And before you make the final product, like injectable product, you need also to microfilter. Because in the venom, even in this natural venom, sometimes some beekeepers, they do not respect very well the quality conditions. For example, they do not have that special membrane to protect the contamination of the glass plate by external spores and so on. And then it's better to microfilter. Yeah.
Thank you very much. Thank you.
Welcome, welcome, Sibel. Okay, very, very good. Okay, so because I think we can. Okay, so in the chat, I don't see here the chat area. Oh, I see. Okay,
you have a question in the chat.
Yes, yes. Let's look. Thank you for bravo, but let's go to work. Okay, for the brain tumor, brain cancer, there are several papers, even clinical things to apitherapy against brain cancer, but it's a difficult disease, very difficult disease. But I give you one very interesting method from Egypt. There is one neurosurgeon there. They get out the tumor from the brain with neurosurgery normally, but before they close the wound, you know, before they close the levels like the meninge and so on, they put honey. So they put honey on that area. Of course, it's diluted honey, I presume that is diluted honey, is not direct honey because honey is hygroscopic, will disturb the brain. And they noticed in the years to come that the patients do not have relapses. The cancer does not come anymore to that area. We know that most of the cases when the surgeons, they take a tumor from a certain place, stomach, bones, and so on, the tumor comes back after 1 to 3 years in the same place. But this Egyptian neurosurgeon found out that the tumors does not come back anymore. And one explanation is when you give honey locally, honey helps locally the local immune system, the macrophages, neutrophils, the stem cells, and so on. And probably it's kind of not only anti-inflammatory, but it regulates very well the functioning in that area with the good stem cells. Okay. Sibel, you have another question? I see your yellow hand.
Oh, sorry.
Okay, no problem.
I forgot.
No,
Thank you.
no problem. Okay.
One more question in the chat, Dr. Stefan.
Yes.
How can we treat the lower back or sciatic nerve?
Yes, this is easy to treat. The best is Bivanomi therapy. If it's the lower back pain is caused by contraction of the muscles, then it's Bivanomi in cream form or bee stings or injections. This goes very well in a couple of sessions. If it's more severe, like discal hernia, you need more sessions. But believe me, I went through 2 discal hernias 2 times at different times of my life. And I got out of these discal hernias. Of course, it was not complete elimination of the disc with Bivanomi. So Bivanomi therapy is the best one for this. Yes, and then it's this one with can we dilute the honey intravenous? Professor Mamdouh Abdulrahman is our world expert in honey intravenous, and he told us that he uses dilutions of 2%, 5%, 10%. I believe he used once, a couple of times, even 20% honey in solution. Okay, and Professor Badia Yusuf says that she's working with Venom against axonal degenerations. Yes, very good. There are many neurological diseases which can benefit of Bivanomi because Bivanomi activates the blood flow in the nerves too. Okay, so we can also go back to the questions a bit later, but let's not delay too much because Dr. Azevedo is here with us. And Dr. Azevedo, can you activate your microphone? Oh, let me put you as co-host. Okay, to be able to share your screen. And please activate your microphone.
Yep,
yeah,
it's done.
Yes, wonderful, wonderful. Okay, so Dr. Azevedo is working in Canada, in Vancouver, probably the most beautiful city in the world, in British Columbia, the beautiful paradise in the world. And he's coming from Brazil, and he has a huge experience in gynecological diseases, and it's a big fan of the use of bee products. Please, Dr. Azevedo, you can share your screen now, or I can also present from my own computer, and then you'll say next, next, next. How do you prefer?
I prefer to share.
Okay.
Because I did some
changes.
some modifications. Yeah, that's why.
Okay, very good.
Let me see here.
Okay. Zoom didn't solve this problem with the sharing the screen. It's so complicated sometimes. Did you first open your PowerPoint?
Yes, I have. It's open,
okay.
But I can't see how to share.
Okay, so down on the screen, it's a green button which says share screen. Down here on the desktop. Can you see me now?
Yes.
Come back. Okay. So go down with the mouse to the in the middle at the bottom where is a green button called share screen. Down.
I can't see it.
You cannot see it?
No.
Probably
Chat,
you are
reactions.
maybe you are not in the view. Go to the view to the gallery.
Gallery.
Okay. Okay. And okay. One other thing. It's Dr. Azevedo. It will take 30 seconds. Send me please your PowerPoint by WhatsApp now. By WhatsApp, because it's not so big. Just make a break. Send me by WhatsApp, and I will activate from my computer.
Okay,
This is the best.
I'll try.
And meanwhile, before you send me, I see here, I received from Kenya an invitation to come to give lectures on apitherapy from Professor Njeri Wamae. And yes, we'll do it very gladly, all of us in many, many other countries. Okay, so I'll check also my WhatsApp. If you send it. Okay, not yet.
I sent you a link.
Okay, okay, very good. So I opened the link now. I received it. Oh, this is with Microsoft sign in. Then can you send me just the PowerPoint and not the link? Because this is complicated, Microsoft. Just the PowerPoint as a attached document.
I'm sorry for that because technology is not my cup of tea. Sorry.
Yes, no problem. We all have problems in
Okay.
Or you can send me by email.
Yeah, I sent to you by email also.
By email, but
the
the
link.
link. And
Yeah.
but I need the PowerPoint because I cannot open the link. It's in Microsoft, and I cannot open it because I don't have this permission from Microsoft. Can you send only the PowerPoint?
I'm trying. Yeah.
Okay. You need to save it first on your desktop, maybe. Okay, so I believe now you'll be able to share the screen again, Dr. Azevedo. I saw it was a problem, technical problem in Zoom. Somehow they took out your co-hosting. But now you can, yeah, and here it's very funny because some people, okay. So now try to make again the share screen, classical share screen. Okay, did you find that green button?
Oh, I can find it.
You can
I
find
can
it.
find it. Oh my goodness.
Yeah. Okay. Okay. Then. Okay. Let's start the discussion with the rest of the group on other issues, and then calmly you can you find a method to send me by email, just the PowerPoint, and then you just tell us. Yeah.
Okay.
Okay. So.
Sorry.
Okay. No problem. Okay. So, dear friends, any questions or comments on this conference?
Professor, Doctor?
Yes, Wanja?
This is Wanja again. I do believe you have seen Professor Jerry Wamai from Kenya commenting on this. And she's actually been in the laboratory work, and I think she can possibly open her mic so she can introduce herself a little bit so that she can be the link to our research in this area, epitherapy. Thank you. Jerry Wamai, please open your mic and introduce yourself and invite the team to get in touch with you.
Thank you, Professor. Let me put on my video. Professor Stângaciu. I hope I'm pronouncing your name correctly. I think Wanja was asking you to invite me, and I hope I'm not ambushing your conference through the Kenyan network, because Wanja is the one who has asked me to turn myself on.
Yes, it's very, very good. We want to cooperate with all the countries in the world, and maybe you'll organize the first Kenyan conference on apitherapy in microbiology. What do you think?
We will discuss that, and that's very exciting. Kenya is a hub of many international meetings, and Wanja, Adai, and other Kenyans will work hard to make sure that happens in Nairobi, the city in the sun. I think Wanja asked me to introduce myself. I don't know whether this is in order.
Yes, it is. Please tell us. Do you use also bee products? Do you use also bee products against bacteria and microorganisms and so on? Or not yet?
Oh, all right, very good. I am a microbiologist by training. I trained in the US and have been working with the Ministry of Health in Kenya after my training. And in our premier research institute, the Kenya Medical Research Institute, I have like over 32 years serving that institute. But more recently, I moved to the academia, and my last position was as a dean of a school of pharmacy and health sciences in one of our universities. And why I moved from the research institution to the academia is because I felt that what I knew, I needed to reach many more young people so that I can encourage them to join global health and have an impact on the wellness of populations around the world, and also think of global health from an inside way, not from the outside. And what I mean by this, think local solutions for local problems, but also embrace the international community, because as what you said, Prof, in your last presentation, we are not going to be working alone. We need to work in a team, and we need to consult and reach out to other persons in the areas that we work on. We all have one vision: improved health for everybody on this planet, because all lives are equal and health matters equally for everybody. So we must go and work very hard to ensure that there is no inequity in health. I think that's enough introduction about myself, and thank you, Prof, for allowing me and allowing the Kenyan colleague here to barge into your program. Thank you.
Yes. Welcome, Prof. Njeri. And we look forward to cooperate with you in the future. And by the way, are you also already a member in our Api-Microbiology network?
Not yet, but I will be. I will be in a flash, because I didn't even know about this until Wanja invited me. The only thing I can mention is that I am currently on retirement, but I am not tired. So I'm busy promoting Forever Living products, and one of our main products in Forever Living products is honey and bee products. So this is actually very exciting for me to be among a group of very knowledgeable people in bee products and apitherapy. Thank you very much.
Okay. Thank you too. Okay, Dr. Azevedo, any good news? If not, I have one other proposal, Dr. Azevedo, is I have your presentation. It's not with the changes, the last changes you made, but you can send the same presentation afterward to the group, inside the group.
Perfect.
So it's then they will have the updated presentation.
It sounds like good. Yeah. Okay.
Okay. So let me close this one. Okay, it will take a few seconds, and I'll open your presentation. Then we'll do it from here. And you just tell me next. Yes?
Okay, thank you.
Okay, so let's do the share screen. First, share screen. Yes. Okay. Here, the screen. And I believe it's now, it should come, it's full screen, yes?
Yes.
Okay, please start.
Okay, thank you so much for this opportunity to present this.
Sorry, once again. I think we need to close, all of us, the cameras, because the connection is not so good. Please close your cameras. I'll close also my camera and also my microphone. You have Wi-Fi or cable connection in your apartment?
Wi-Fi.
Wi-Fi, okay. So maybe it will be good that you close also your camera and you just speak, yeah? And
Okay.
then after the conference, we can open again the cameras. Okay.
Sounds like good. Yeah. Fair enough. Okay.
Yes, please start. You see the screen.
Okay. Thank you for your help. Actually, it's a great privilege to speak with you all. It's an international conference, so thank you so much to Dr. Stefan Stângaciu and Dr. Mariman Segeni. In fact, I am a medical doctor, surgeon, and my formation is about allopathic, but I never liked so much about drugs, about use drugs, because a lot of side effects. I used to be a professor in Brazil, as Dr. Stângaciu told us, but now I am here in Vancouver because I retired from my university, and now I'm here in this beautiful city. So we are talking about the prevention and treatment of vaginal candidiasis with Api-Phyto-Aromatherapy. Next, please. So the bee can talk. How can I help women suffering with vaginal candidiasis? Is it possible? Next. Well, vaginal candidiasis is caused by a normal growth yeast-like fungi in the mucosa because it's a commensal microorganism. Normally, it is present in the genital tract. But when there is an imbalance, so this kind of microorganism, Candida, could grow up. It's caused by basically Candida albicans but we can see also tropicalis, glabrata, cruzae, parapipsilosis, etc. It's important because it strikes millions of women annually in all the world, and it's very problem. It's a very concerned public health. So it's we need to understand better and how to treat this pathology. Vulvaginal candidiasis is the first cause of vulvaginitis in Europe, the second in US and Brazil. 75% of women in one moment of her life will present this problem. Next one, please. Basically, Candida albicans in 85 to 95%, but others will be present in this affection. Next. Normal vaginal flora is dominated by Bacillus. It's good. It's very good, and maintain the pH, vaginal pH, about 3.8 to 4.2 or 4.5. So it's an acid environment, and avoiding that bacteria and other organisms can grow up. And some lactobacillus produce also hydrogen peroxide that is very good as a microbacide. But the problem is that after onset sexual activity, some microorganisms could grow up. Next, please. But this kind of microorganism, it isn't a sexual disease. Even child can present this problem. So we have some risk factors. For example, diabetes mellitus uncontrolled could be a factor to help to grow up Candida gens. Corticoid therapy, antibiotics, poor hygiene, estrogen therapy. For example, this estrogen into contraceptives. Pregnancy, during the pregnancies, it's very common appear this kind of problem, vulvaginal candidiasis in the pregnancy women. IUD, it means intrauterine device. Intrauterine device is a contraception, it's a kind of contraception, could develop also candidiasis. HIV infection, AIDS, also we have some low immunity. Our immune system is attacked, so these microorganisms can grow up. Also, some methods as sponge, nonoxynol, diaphragm, some contraceptive methods, mechanic contraceptive methods could help to grow up this kind of microorganism, and the women can suffer with this. Next one. Again, antibiotics, hormonal contraception, drugs, inappropriate eating habits and lifestyle, it's so important. Synthetic underwear clothing, besides chronic disease, such as diabetes mellitus, is very, very important to development of fungal infections. Next. What are the symptoms about this disease? Intense vulvar itching. It's very, very boring. thick curd vaginal discharge, vulvar erythema, and white thick pads. Also, these microorganism candida could be a problem called intertrigonal. The spread of candida infection into the folds of skin create a rash-like appearance under the breasts and thighs. It's very, very problem. It's a very, very serious problem for not only women, but also everybody. Next, please. Here we can see in the next one, we can see this kind of discharge. It's a speculum view into the vagina. Here we can see the cervix and this thick white vaginal discharge like cottage cheese-like or yogurt. Sometimes it's called like yogurt. It's very similar. And the patients can also present dysuria and dyspareunia. That means dyspareunia is pain during the intercourse, sexual intercourse. Next, please. Here is an infant, child, with this affection. We can see erythema and these plaques on all the genital area. Next. Well, the diagnosis is basically clinical. pH is normal because testes grow up in an acid environment. The whiff test, that means a smell test when we put drops of potassium hydroxide in discharge in a lamina, for example, we can realize some smell like fish, like a putrid issue. But if you can see under a microscopy some hyphus and some how I see, okay, but some sporulus, you can realize that for sure it's Candida. Also, a culture of the discharge can help us to identify this problem. Next one. Next, please. Exactly. Under microscopy, we can see this is sporulus and hyphus, as you can see here. Next. But it's very important to do a differential diagnosis and what kind of problems we can differentiate. Trichomoniasis and bacterial vaginosis. Trichomoniasis is caused by Trichomonas vaginalis, a protozoary, and vaginal vaginosis as a bacteria that cause this malodor and discharge, a very boring discharge that can differentiate from candidiasis. Gardnerella vaginalis that can cause this kind of problem. Next one, please. So, allopathically, we have a lot of products, pharmacological problems, as butuconazole, clotrimazole, miconazole, nystatin, very common, terconazole, etc. But we have a lot of side effects. So, is it the most way to treat this kind of problem using these products? Actually, we can use these products, but this problem can come back again. That's the problem. Next one, please. So the treatment, in my point of view, should be holistic, treating the person as a whole. It's important, the lifestyle, change some kinds of lifestyle, improve the immune system using cinnamon, for example, star anise, ginger, dandelion, garlic, onions, turmeric, etc. Making a broader and a more complete diagnosis. We need to be sure about this problem. Guide an adequate and organic diet and a lot of water. Water is very important. Our body is made from 7% of water. So we need water, and the people in general don't like to drink water, but it's important. 2 or 3 liters per day. It's very important. Also, appropriate physical exercise on a daily basis. In other words, change lifestyle. Take in consideration also psycho-emotional aspects of the patient. Bad emotions can come, and it can produce a low immune system problems. So these emotional situations could be also healed. But before specific vulvaginal treatment, it's important to detoxification of the body, mainly intestines, liver, lungs, and kidneys. Next one, please. So how to treat vulvovaginal candidiasis efficiently, avoiding pharmaceutical drugs? First of all, nutrition, emotional conflict treatment, desintoxication, and Api-Phyto-Aromatherapy. Next one, please. So how can we treat this emotional treatment? There is something new for me and very useful. EFT or TFT, what does it mean? Emotional freedom techniques or tapping freedom techniques. Using some points of Chinese medicine, we can touch these points as in eyebrow and inside of the eye, under the eye, collarbones, and lips under the nose, upper lip, chin, and top the head, also karate point. We have here 9 points, and with appropriate presenting these emotional conflicts, bad emotions could be disappear or minimized. So it's an important issue to consider. Next one, please. Nutrition is very important to concern about that. No sugar, never sugar, is so bad. Decrease bad fats. And no pops. Here we can see pop. Pop is disgrace, it's terrible. Decrease refined flour. Organic flour is better. Decrease embedded food, and also red meat as well. Decrease canned goods also. It's not healthy. So nutrition is important. If you have Arabic horse, what kind of food you can give to him? It's very valuable. Every kind of food? Of course not. The best one. What about us? We need to put into our body the best, because our valuable is has no dollars. No, our vol is so high. Next one, please. Disintoxication. How to do this before the specific treatment? Intestinal, liver, lungs, and kidney. Next one. Focus in herbal therapy or phytotherapy. Liver disintoxication could be using aloe vera, cardamom, artichoke, spirulina algae, white basil, guava, boldo, chamomile, calendula, and calabash. There is some examples to improve our liver, and it can be disintoxicated as well. Next. Kidney, we can use lemon or lime. Here in Canada, it's very common lemon. Lemon we can see as a Sicilian italic lemon, and the green one is lime. We call lime here. I don't know in your countries, but here is this way. In Brazil, no difference, just lemon. Also onion, corn cob hairs we can do with these. Crease, it's the cabbage family, and kidney tea as the dandelion root, nettle root, etc. So using these herbals, we can detoxification our kidney. Next one. And lungs, we can use water. Dr. Stefan showed us about this in your telling about gurgles, and use this to help our lungs. Also, water vapor. Thyme and ginger are very, very important. Oregano, rosemary, or alecrim. Alecrim is called in Brazil or other countries. Rosemary here is very useful. Garlic and onion I use in my everyday diet. Eucalyptus and peppermint also. Next one, please. Next, please. Okay, so specifically, we can use.
So, sorry, 1 second again, Dr. Azevedo, because it's somebody making noise. I'll make all the current participants. Okay, so I come back. Can you speak? Can you please, do you hear me? Dr. Azevedo?
We can hear you, but we don't see the presentation.
Okay. Okay, now it should be okay.
Okay, now, yeah, okay. Okay, let's continue. So specifically, we can help people, women with cadidiasis, using propolis, beeswax, coconut oil, and essential oils. How it works? Next one, please. Can really propolis cure yeast infection? We know the answer. Absolutely yes. Next one. Propolis has a very nice antifungal activity, and here we can mention the propolis, and sometimes called Alamo propolis, but the proper name is propolis. It's very, very good, has a very good activity, antifungal activity. It was tested not against Candida albicans, but Glabrata cruzi and others. This propolis in Turkey had a higher antifungal activity, but as we realized by Dr. Marcucci from Unesp in Brazil, he told us about green propolis in Brazil, very common in Brazil, and also very useful against Candida albicans. And basically against all kinds of fungi. Next one, please. Here we have a propolis. In Europe, North America, here in Canada is very common. These countries and these aspects present this resin that our friends, the bees, can extract this kind of resins from these trees to make propolis. Next one, please. The Brazilian propolis produced were the main botanical source of B. dracunculifoides. His name is not easy for me. It's highly recommended by modern herbalists to use as anti-inflammatory and adjuvant in the ulcer properties. This work was made by our friend, Dr. and Professor Paulino from Brazil. Very, very nice experience he has in this field. Next, please. Another experience in Brazil, in Paraná, in Maringá, and State University of Maringá, near my former city, Londrina. I used to live in Londrina during 20 years, working at Londrina State University, but in our neighborhood, they study a lot propolis, and they realize with this work that was published in this journal, and the activity of propolis, not just raw propolis, but this kind of propolis, I can see properly here, but they are very good action against Candida. Next, please. We know that propolis has anti-inflammatory properties. That's why it's very useful in vaginal candidiasis, because we have an inflammation, a very spread inflammation. And this inflammation could be helped by this product, by propolis. Next one, please. Also has antioxidant properties that can help the whole body and improve the health and fighting against this infection, this fungal infection. Next, please. Another paper about the efficacy of propolis and vaginal or vulvovaginal candida. Next. We have a lot of papers, a lot of works about this issue. So we have no doubt that propolis is very, very useful against disease, against this inflammatory disease, infection disease, all of them, not just fungal disease, but bacterial and virus. as well. Next, please. Now, bee wax. Bee wax is made, is one beehive product, and contains vitamin A and vitamin B. Vitamin A is essential for mucosa trophism, for skin and mucosa trophism. So as we saw in that child with vulvaginitis, that very important erythema, bee wax could be help in this situation. We can also stir this bee wax with honey, and make a cream to put in these skin lesions. Next, please. Coconut oil. I use it for myself every day, every single day. Coconut oil is from the name, scientific name, Cocos nucleata. Is popular called coco da Bahia because it's very common in Brazil, and then we have a coconut coast in Brazil. Is a beautiful place. I recommend you to visit this place, Coconut Coast in Bahia, Brazil. But other countries, Malaysia, for example, Sri Lanka, India, has tropical countries can have this kind of plant, this tree, and we have a lot of studies demonstrating that is rich in some substances that can use against microorganisms as yeasts. Actually, the coconut palm tree can called the life tree because every single part of this tree, this plant, can be used for us, including during the Second World War. A lot of soldiers receive this coconut water intravenous, and it's incredible, and it was very important to save their lives in that time. Next one, please. Now some essential oils, as Rosmarinus officinalis. Rosmarinus also can be used in as essential oil. Is very active against yeasts, against vulvaginal candidiasis. We have here one paper, Buona and et al. In 2016. They wrote about this property. It is better than clotrimazole, fluconazole, and the traconazole that are products, pharmacological products used fighting against Candida albicans and other kind of fungi. Next one, please. Other essential oil, melaleuca, actually sometimes is called tea tree. It's very interesting also because It's very useful. It's used more than 100 years in Australia. Is primarily derived from the plant, a native plant from over there, Melaleuca alternifolia from Australia, is largely used in antimicrobial and fungal properties, reporting powerful action on candidiasis. Next, please. Menta is very nice. Is essential oils, have good antifungal activity against different strains of Candida albicans. And also, there is this kind of plant in the herb in Morocco. And here, we have also here in Canada, in Brazil, in other countries, we have a lot of kind of species of Menta. And also a report about the efficacy of this essential oil made from Menta in this infection, in candidiasis infection. Next one, please. So Candida is, we spoke about this in the beginning, is opportunistic organism. And in normal conditions, in a normal vaginal environment, genital tract, female tract environment, rich in lactobacillus, it's normal. We can't find this microorganism. But when we have an imbalance, a disequilibrium, so the microbiota can change and this kind of microorganism can grow up. So we propose to formulate a vaginal cream composed of propolis, 1% bee wax, coconut oil, and essential oils, Melaleuca, Menta, and Rosemarius officinalis. We propose to formulate this product to treat, to help vulvovaginal candidiasis. Next one. So, in conclusion, still the focus should be only to relieve symptoms, but an holistic herbal or therapeutic approach, considering the woman or women as a single indivisible being, hopefully we can make a contribution to holistic women's health concerning that very common and annoying, very, very annoying disease that is vulvovaginal candidiasis. Next. So next. Yeah, thank you so much for our time and attention. And now there is some pictures. Oh no, there isn't. I sent to Dr. Stefan, but unfortunately it's not possible, and I can manage this properly. I mean, Zoom. I can I can't found this button, this green button to share these pictures. But here in Canada, here basically in West Coast, Vancouver is one of the biggest cities in the Canada, is the biggest one in the British Columbia. British Columbia is called the beautiful, the beautiful one. In our cars, there is a sign telling this. Oh, thank you. Thank you, Dr. Stefan. And here we have beautiful beaches and mountains and rivers and lakes. And we are here, my family and I, about 3.5 years, almost 4 years. Yeah, this picture, this in the center, the second one above. No, yes, this one, yes. I live in this area. Yeah, one of these buildings. Yeah, I live. Yeah, and here in the left side we have the Stanley Park, beautiful place, and the nature is so rich over here, so rich, and the air is very pure. You can breathe nicely. It's very good. Yeah, I appreciate a lot. Yeah, here, yes, is also nearby our place. Also, I use my bike to go to my work, and kayaking in this place. Yeah, it is. I'm very happy to be here. Indeed. Yeah, oh, nice. Yeah. Okay, thank you so much for your attention. And I'm sorry, my mistakes and my difficulties in show better my presentation. Thank you.
No problem. Many people had this kind of technical problems, including myself. So it's a problem with the Zoom. The software is not so adapted for. Okay, here in the chat, it's one question is, how do you apply the product directly on the genital area? What is the practical application? How do you do exactly?
Yes, we have some devices. We have devices to put inside syringe, like a syringe. We put inside this cream. It's a normal device to use in gynecological creams. So we put here and introduce into the vaginal. Oh, now now it's possible to send to you this this presentation by mail.
Okay.
Oh, by mail. Huh?
Okay, no problem.
So
Yes.
you can use in this this way, and also we can spread during the skin area this cream. So that's it. I think that was the question. How
yes.
to? Okay.
Yes, how to apply, yes. And then if you will be kind enough to share your presentation with the participants.
Absolutely.
Absolutely, yes.
Absolutely.
Yes.
Yeah, my pleasure.
Yes. So we will share it in our WhatsApp group about this. Okay. Yes. Okay, very good. Okay, thank you very much, Professor Azevedo. It was really very good, very practical presentation.
Stefan, I have asked a question for
yes.
by chat. Thank you, Professor, for this presentation. I am from Morocco, and we have done a very good effect on antifungal impacts of manta from Morocco, and we have many species. I will send you the article. Very interesting.
Oh, thank you.
What about salt? Because sugar, it's dangerous for our health. But also salt, when we consume a lot of salt in our nutrition, it is not very good.
Yeah, I think we use here Malayan salt, that rose, that pink one is berry, is not refined, you know.
Yes.
So it's more raw, it's more natural. We use here only this
Okay.
kind of.
Okay. It is very interesting also your proposition about relationship between diabetes and infection. Very interesting, very relevant, because here we have a close relationship between inflammation, infection, and chronic pathologies. Because with diabetes, we have frequent urination, and you should have this detoxification. Very good in the kidney. So it is. You give a good plants from Australia, but you have the Manuka honey from plants of Chichiria. It is Manuka honey also. It is the same Manuka honey. So it is possible also to, no, not the same plants. It is the same plants.
I don't know.
Yes, the same plants, because Chichiria, it gives this honey from also New Zealand, and Manuka honey, it's very good also. You could also use Manuka honey instead of this plant, because it is the nectar of this plant which gives Manuka honey. Very interesting. Thank you. Thank you. I had been in Quebec, but next time I will come to Vancouver. And give us your email, perhaps, when we come.
Yes, sure. It will be a pleasure to.
Thank you. And also for you, Morocco.
Here. Yeah.
Also for you to visit Morocco, to visit Fez. It's very nice. Stefan, it's the ambassador. Stefan make this community. So we should discuss with him and to make an event very interesting with some experts from the world, because it is a very good topic. We have many problems with these vaginal infections in Morocco, very, very big problems. And this cocktail of plants, also essential oils, rosmarinus, lavandula, eucalyptus, it's very interesting. But we would like to have your practical, some figures, some shame for these applications. If you have some illustration, it will be very useful. Thank you. Thank you.
Okay, very, very good comments. And I see here the hand from Mwitsa. Mwitsa, can you please activate your microphone and also your camera to put your questions or the comment? If camera is not going, oh, it's going.
Thank you, Professor Stefan. Yeah, this presentation was very, very well. We appreciate it. We learn a lot through this conference. I would like to ask a question, but before I ask my question, we have a new participant here, and he would like to be put on the platform. She's a professor at the University of Rwanda. In pharmacy.
What is her name? What is her name?
Professor Mary Jane.
Mary Jane. She's now here with us?
Yes. Yeah, I will share with you maybe his email.
By chat, yes. By chat, give me her name, give us her name, and we'll connect her. No problem. Yes, and what is your question and comment?
Yeah. My question, I would like to know if concerning the treatment of candidiasis, the professor Elbens told us, if we can mix propolis with beeswax, and then we add maybe the essential oil from eucalyptus. If we can mix those three products to treat the vulvo vaginalis candidiasis. This we Elbens told us.
Okay. Yeah. Okay. So yes, thank you. Basically, Dr. Azevedo, I saw also in the chat, the participants wants to ask you a $1 million formula of ovules and creams and recipes, ingredients. What would be your advices? Because it's a huge topic, this one. What would be the rules? How to make such creams and ovules and so on?
Yeah, Actually, it's a propose. It's not. It doesn't exist yet. This cream. It's just a propose. You know, it's basically with propolis 1%, beeswax 100 grams.
Oh, let's write. So propolis 1%.
Yeah.
Yes.
Yeah,
Beeswax.
50 micrograms by ml. Beeswax 100 grams. Coconut oil 25 grams. And essential oils, the same concentration, 49.8 milligrams of melaleuca, mentha, and rosmarinus.
Maybe it's better that you send the formula through the WhatsApp group.
Yeah, sure.
Because,
sure.
yes,
yeah.
there are some details. The propolis is green propolis or red propolis or
poplar.
Poplar.
Yeah, poplar.
Okay. Yes, very good. Yes, excellent. Okay, okay.
Thank you for your question.
Yes, and we have here Willis Otalo. Can you activate your camera too, Willis, if it's possible? Yes, we see you. Okay, please.
I was asking which bee product is effective in treating throat infections?
Treating
Bacterial
what?
throat infections.
Throat infection?
Yeah.
Okay, I will answer you quickly. So it's honey and propolis basically here. It's very easy to reach. Honey and propolis extract, gargling. You can also use royal jelly, some bee bread too. And if it's very serious, you can add some essential oil. Like, yes. But this is normally easy to treat. You need to go also for the causes. Maybe the person eats too much sugar or too much milk. Like Dr. Azevedo said also before, you must change the diet because a bad diet will favor the microbes.
Which essential oil?
So
specific?
essential oils, I cannot tell you now, but it's near the breathing part, maybe also like eucalyptus you can try. If it's very severe infection, then it's thyme oil. But thyme oil is sometimes too caustic, too burning. So you can use some other one like melaleuca, but also ask in your area who is specialist in aromatherapy. And if you have a good laboratory near you, you can do also aromatogram, like you can check each essential oil for this special microbes. But normally 99% of the cases, if you make a combination of honey and propolis and with some warm water and you gargle, and you chew or suck also raw propolis every day, several hours per day, in 1 to 2 months, it will be okay.
Okay.
Yes, thank you. From what country are you, Willis?
From Kenya.
From Kenya. Very good, very good.
Thank you.
Okay. So, yes?
Yes, I forgot to mention milk, and you mentioned now. Milk is terrible, cow milk.
Yes.
The best one is from our mom when we were child. But milk is responsible, this cow milk produced by industry with antibiotics, with conservants, with a lot of garbage, That's in my point of view. It's terrible for our health. So it should be eliminated. No milk.
Yes, I agree with you 100%. The only milk I recommend sometimes to my patients is goat milk, but not in form of milk, but in form of yogurt or kefir. Small amounts when it's really needed, but normally we can live without this one. Yes, excellent communication, excellent questions and comments. Thank you very, very much. Now I'd like to ask Professor Nariman, can we go to the short poster presentations?
We have one more question for Dr. Elbens.
Yes.
It's in the chat. The propolis vaginal cream, is it okay or safe for women in pregnancy?
Yes, yes, absolutely, yes. But we use not in alcohol dilution, but in water dilution, because of course it's irritating, yeah. But it can, absolutely, no contraindications.
Thank you, thank you.
Very good. Okay. So, Nariman, besides Prof. Sibel Silici, any other participants with the poster can share?
I will check my mail. I didn't receive a mail from the other participant.
Okay, so let's hear Professor Sibel Silici with the short poster presentation, like 5 minutes, like we said, and then I'll present also from Romania that paper on the use of bee products for cat and dogs wounds. Okay, Prof. Sibel, can you hear us?
Yes, I'm here, but please, video, could you open?
Oh, yes, wait a second. Yes, and I'll put you also as co-host. Yes, very good. Now you can share the screen.
Yes,
yes,
okay, thank
yes,
you.
very good.
In 5 minutes, I will try to summarize. Just a second. Yes, my third talk on microbiological evaluation of perga bee bread. We know that consumers could assume that pollen and bee bread are similar bee products. However, bee bread is more valuable compared to pollen because of the results of lactic acid fermentation of combined product by pollen, nectar, and honeybee salivary enzymes by microorganisms such as bacteria, Pseudomonas, Lactobacillus, or yeast like Saccharomyces, or both, and is characterized by a wide range of biological properties. Also, bee bread can be affected by the microbiota of bees as it contains the secretions of bees' salivary glands. Bee bread differs from pollen in terms of enzymes, lactic acid, sugar, starch, protein, and carbohydrate content. Bee bread is including peptides, free amino acids, phenolic compounds, minerals, B vitamins, and vitamin K. And it is more easily absorbed in the human body. All microorganisms in bee bread have been studied. However, any study about whether there is a difference in microbiologic reproduction between long-stored or dried and fresh bee bread. In this study, we aim to investigate that there is a difference between fresh and dried or stored bee bread in terms of microbiological reproduction and susceptibility of isolated strains or not. In this study, the 34 strains were isolated in taken fresh perga samples. No microorganism was growth in dried or stored perga samples. The isolated strains were identified by conventional Melditov-MS methods. There were Aspergillus, Rhizopus oryzea, Mucor circinelloides, Bipolaris, Trichoderma, Paecilomyces varioti, Penicillium chrysogenum, Codamea ohmeri, Bacillus altinodis, Bacillus licheniformis, Bacillus megatherium, Micrococcus luteus, and Serratia marcescens. In the microbiological analysis of the perga or bee bread, we identified microorganisms that could be dangerous for the respiratory system. in addition to microorganisms that provide probiotic properties such as lactobacilli. For this reason, I don't recommend also high air for respiratory disease such as asthma, and I recommend also dried perga with the study. Yes, this is okay enough, or I don't know, time is okay.
Okay, very good. Very good. Okay, good. So,
Dr. Stefan?
yes.
We have a response from EPAV. He had his presentation and can present.
Okay, very good. Okay, Bob, can you activate your camera? Very good. Where is it, Bob? Can you activate your camera to see you, because we cannot see you?
Okay, I'm working on that.
Oh, okay.
Yes.
Then did this succeed? Yes, Solomon Ipav. Yes.
Yes.
Okay.
Thank you, Prof. Yes.
Yes.
I'm happy to be here with us. I sent my PowerPoint just now, but let me from here pick up.
You sent to
sent it to me or to
yes,
Dr.
yes,
Stefan?
Prof. No,
to me?
Yes, Prof.
Okay.
But let me see if I can share from here.
Try to share and I will find it.
Okay. Let me see.
Okay.
Can you hear me now, sir?
Yes.
Trying to see how I can share from my side.
I found it. If you can share, I can do it.
The host has disabled me from screen sharing.
Okay, wait a second. Okay. Now you can share the screen if you want.
Okay, Prof. Okay. Where is my work now? I am there. Let me. Where am I? I'm trying to get through with that.
But did you send the presentation to Professor Narimane?
Yes, I did.
Okay, but then Professor Narimane, you can share the screen. Maybe it's better you share his presentation.
Okay.
It's better because you are co-host, and then he will say next.
Okay, let me try.
Okay.
Yes, and full screen.
Yes, Prof. Thank you very much. I can see the screen now. I'm Selumu Ipiaf from Nigeria. We are trying to follow up propolis from a modest laboratory. And you know, while we look at the things that you have done, we are thrilled and we are challenged also to do better things and improve on our work We have a couple of works, but this is what I put up to us: isolation and characterization of alpha and beta marines from propolis obtained from Benue State. This is a state in the middle belt of Nigeria. And I am there with some of my professors who are overseeing the work with us. Next, please. We, of course, like we know, I wouldn't bore us with the basics of propolis, but we thought because it is phytogeographical in nature, we would also look at the chemical constituents of it around Nigeria, and we found very interesting things about it. Can we move again? Next, please. So we set out to get some chemical constituents of the propolis around the area where we stay, the state, and we discovered that several things. We had up to 8 constituents, but we reported 4 here because of some of the activities we felt we got in the course of the other aspects of the work. We found the alpha marine, beta marine, and their acetates. These are pentacyclic triterpenes. Can we move, please? Next. And so we carried out column chromatography. We got fractions from it. We carried out NMR. We used a broker AV3, and we did mass spectrometry too, just to ascertain the constituents. Next. So we got the sample from beekeepers in Benue State, and they reported to us. We tried to get the kind of the botanical surroundings, and they told us Marantis, Polyandra, Deuterium, Microcarpum, and Bocchia africana are the principal trees around the place, and they suspect that those are the ones that the bees have been picking from. So that's the report they gave to us. And we carried out normal chromatography. Can we move next, please? So the isolated compounds were pulled together using TLC, and after that we carried out the proto-NMR and mass spectrometry to analyze the compounds that we had isolated. Next. Next. So we had 117 10 mil fractions that we got from the work, and out of it, a total of 15 fractions were pulled together so that on the basis of the TLC similarity. Next. These are the fractions that we brought up, we reported here. We reported A is alpha marine, B beta marine, C alpha marine acetate, and the acetate of beta marine is D. Next. So I jumped anyway, but that's what we had when we had carried out mass spectrometry, proto-NMR, and comparison with literature reports that we've had. Several of them, we noticed that the compounds we have isolated were alpha marine, beta marine, and their acetates. Those are the structures of the compounds. Next. The same structures. A, B, C, and D. The last one is beta marine acetate. Next. So when we got this out, we tried biological activities on the compounds. We noticed that we first checked different solvents from a varying polarity just to ascertain the activity. Even though we know that basically activity of propolis is synergistic. It's synergistic in nature, but when we checked that, we noticed that there was much activity with the very polar compounds. So here we have noticed that this is the reason why traditionally, or this may be the reason why traditionally, inflammation, pain, malaria, and some of these issues that border around pain are treated using propolis. Next. Thank you very much for the opportunity. I just thought to stay within the 5 minutes. I hope I've made a whole lot of sense. Thank you, Prof.
You're welcome. Thank you for this nice presentation, Dr. Ipaf. Very, very interesting concerning the chemical composition of Kenyan propolis.
Thank you, Prof.
We have a question from Vanja Kinutia.
Yes, thank you very much. The propolis that was being discussed is actually from Nigeria, not from Kenya. So thank you, Dr. Ipa. I just wanted to find out whether you have like publications, scientific publications on the indigenous knowledge, indigenous use of propolis and honey hive products in Nigeria. If you do, I'll put my email on the WhatsApp. You can share with me. Thank you.
Okay, okay, I will look at that. Just forward the email. I will look at that. Thank you very much.
So currently you are not aware of any indigenous knowledge information?
They are. We have.
Okay, thank you.
We have. Yes, welcome.
Thank you.
You're welcome.
Okay.
Sorry, Dr. Ipaf, don't. You are working on Nigerian. It's just a small mistake because I'm receiving lots of email.
Yes, yes.
Okay.
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 Any other abstract, or should I present now, Prof. Nadimane, or it's anybody else in the row?
Let's ask if Shogo Solomon is here with us.
Yes,
Hi.
I'm here.
And would you like to present your poster now?
Yes, please. I would love it.
Okay. Can you share the screen with us?
Yeah. Let me just do that right now. Fixing some lighting. Am I well visible?
Yes. Oh, yeah. Now you are better. And put the camera a bit down, more down. The camera.
There we go.
Like
You
this.
can see me.
Yeah, now it's perfect.
Good. Thank you for this opportunity. So I'm just going to jump into the presentation. I have a short time, 5 minutes. I'm getting a prompt here, host disabled participant screen sharing.
Sorry, Solomon. Let me find you, because yes, I need to give you the co-host. Yes, okay. Now you should be able to share the screen.
Okay, let me just try that again. And okay, 1 minute. I'm just opening this PowerPoint presentation here.
Let me mute all except you. Okay, so unmute again yourself, Solo.
Which country is he from?
Yeah.
Solomon, from what country are you, Solomon?
I am from Kenya. From
Kenya too.
Yeah, so just give me a minute here. Sorry,
Solomon, did you send me your presentation by mail?
No, I haven't. Can I have your email? I can just send it right now.
Okay, let me send me my mail. You can try to share and send me in the meanwhile your presentation.
Yes.
Okay, so I will present the short abstract from Romania, and meanwhile you will communicate, and then we get yes, not to lose time. Okay, so okay, so it's a presentation on the use of a mixture of honeybee products, honeydew honey, propolis extract, and essential oil, thyme essential oil, for the treatment of cutaneous wounds in cats and dogs. Okay, again, because it's some noise, let me go back and stop share and then mute all. Okay, and then I start again. Okay. So So this is the team. Octavia TAMAS was the main author, and these are the colleagues. And here is the introduction. So I go, so it was a mixture of honeydew honey, soft propolis extract, and essential thyme oil. Okay, and I go directly to the results and discussion. You see here the photos before, during, after of using this combination. And I go here, you see also more clear before, during, after. Here too. And by the way, here one important element is that this kind of product like honey, propolis extract, and essential oil, a small amount, of course, can be put also inside the body before you close the wound. And then you put again on top of the closed wound the same product. So you make a kind of sandwich before and after on the wound, and you see other results here. And here it's also a very severe case with a dog, which was male metis, and it was having a big laceration in the right axillary region. And you see here is the right foot. And then with the honey, this propolis mixture and the essential oil, it was cleaned in 14 days, 2 weeks. It was cured. Here is another one. Okay, you see clearly. It's true that the animals, they heal faster than the human beings because they do not go to McDonald's or they do not drink Pepsi or Coca-Cola. So if they have a good diet, they have better results. Here it's another one here, another one here. So all kind of wounds, including burns, infected, non-infected, you can use this kind of combination because you cover many of the causes. And conclusions here about the healing process and collaboration, research, and yes. Okay, so this was the presentation, my presentation. I hope I was shorter than 5 minutes. And now, did you receive the presentation of Solomon Nariman? Oh, yes. Okay, so you can now unmute. Okay, yes. Yes. Did you receive? Not yet?
Not yet. Let me refresh.
Okay. Oh, okay. Solomon is doing now.
Not
Is it
yet.
up?
No, it's okay, but go to the presentation. Where is the presentation, Solomon? We see here many presentations. Do you have one? Maybe you need to go to another folder.
Yeah, oh, sorry.
So it's better to find the PowerPoint, open it, put it on the desktop, and then you share the screen.
Okay, let me stop share because I've now put it on the desktop. I don't know, I did this before, so.
Okay. Okay. So any other general questions from the public, from the,
Is it up now?
Now it's okay. And make full screen. Yes, down or full screen, full screen.
Full screen.
Yes, there.
There.
Yes. Once more.
Yes.
It's good now.
It's not full screen. Try another time.
No, it's okay. Go with the cursor. Go up where it says slideshow. Go up where it is slideshow.
Slideshow.
Click there.
This is slide control.
No, slideshow above on your PowerPoint, on top, up, where is animations, and then slideshow, and then review and view. Can you see it above?
Yes.
No, go to slideshow on the right.
Slideshow.
On the right, more on the right. Above, more up, up. up, and on the right, it's a slideshow.
Yeah.
Yeah, there. Yes.
Okay.
And now go to the left and click on from beginning.
From beginning, the first.
Click
It
stop.
shows it's on full screen from my end.
Okay. So it doesn't show here because when you share the screen, you didn't went first on the share again. So you need to press share and then again share, and then you open the PowerPoint. Okay, so go down to the share button, and then go to the right again, share, and then open the go to the PowerPoint. Yes, yes, bravo.
It's okay now, yeah?
It's okay, it's perfect. Okay.
I'm so sorry. Okay.
Okay.
Can I start?
Yes.
Yeah, I'm Solomon Chogo from the University of Nairobi. I'm doing my master's in analytical chemistry. Now, this is part of my research work that I undertook from ICIPE, the International Center for Insect Physiology and Ecology. We're looking at the antibacterial potential of different honeys sampled from different locations in Kenya. And I'll just dive straight into the results due to the limited time that I have for this presentation. We had 6 bacterial candidates, and we were using there were 6 bacterial candidates, and we're using 50% honey solution. Yeah, from the sample areas were as shown on the screen: Arabuko Sokoke, which is in the coastal area, Baringo, Kakamega, Karura, Kitui, and Taita. And our bacterial candidates were E. coli, Ear fidicola, that is Ewania fidicola, E. coli, Bacillus apis, Bacillus thuringiensis, Lactobacillus apis, and Serratia marcescens. And for Serratia marcescens at 50%, there was no inhibition, so we didn't include the results here. It will only be inhibited at higher concentrations of honey, but we wanted to work with 50% concentration. Now, we saw very specific inhibition trends with different honeys against particular bacteria. Like we had a very high inhibition from Kitui honey on E. coli, and also exceptionally good inhibition on Ewania afidicola from Kakamega honey. The same happened with Bacillus apis and Bacillus thuringiensis with the Karura honey, and the last one was also Kakamega had exceptional good inhibition for, against Lactobacillus apis. Now, in the selection criteria of this bacteria, we took, we isolated some bacteria from the bee guts, and we also took some environmental bacteria, as we'll see in the later posters. Now, I've put a sample of our culture plate down there just to show an inhibition zone of the tests. So what we'll essentially do, this is a well agar assay, where you will put on the small middle hole, you will put now your 50% honey solutions, and when culturing the media, you inoculate it with the bacteria of choice that you want to test the inhibition against. Now, oh, sorry. So here we classified the bacteria into two categories, where we had the gram positive and gram negative. Now, much studies have been undertaken to show the effect of honey on gram positive and gram negative bacteria. And in many of these studies, you'll always find that for the same type of honey, it will have more inhibition on the gram negative than the gram positive bacteria, and there are reasons to well substantiate this. But we also went a step further to look into the effect of honey on honey-adapted bacteria. The honey-adapted bacteria, this is just the bacteria that we inoculated from different sections of the bee gut. That is the crop, the midgut, and the hindgut, as we'll see in subsequent slide of this presentation. And also the honey non-adapted bacteria, which these are just environmental bacteria, like the Bacillus thuringiensis that's obtained. It's ubiquitous in soil, and also E. coli will have clinical isolates of E. coli. Now, mostly Bacillus thuringiensis and E. coli are not mostly found in the bee gut microbiome, but the remaining 3, the Lactobacillus apis, Ewania afidicola, these are common in the bee gut. Now, there's on the top left screen, there's a diagram there showing the positioning of the bacteria in the bee gut. So L. apis according to the inhibition trends, Elbens was the least inhibited bacteria, and this is found in the foregut of the bee. So it means that this Elbens interacts with the components. We know in the making of honey, the precursor is nectar. The bees go to forage for nectar and then take it back in the hive, and we have honey later as the product. And these bees also, when nursing, they sometimes consume and reject this honey. So the bacteria in the foregut interacts with the honey and the components that in honey more than the bacteria which are in the subsequent section of the bee gut. So we found that the bacteria that we isolated from the foregut, that is Lactobacillus apis, had diminished inhibition against most of the honey, and that was the trend. Ewania aphidicola, which is found towards the rear end of the gut, and Bacillus Bartonelli apis, not Bacillus Bartonelli apis, had quite enhanced inhibition. Yeah. So this shows that the interaction of this bacteria with most components of honey has led to some form of tolerance to honey. So it's not when the bacteria interacts with the honey more, it's not inhibited as much as the others. However, when you look at the collective picture, when we group the bacteria from honey, the one we extracted from honey, and the environmental bacteria, we find that constantly the bacteria that we obtained from honey gut are less inhibited than the environmental bacteria. Now we went a step further to characterize this honey just to find their composition, and here we analyze for physicochemicals and phytochemicals of the honey. Total phenol, we analyze for total phenols, flavonoids, their antioxidant activity, carbohydrates, the pH of this honey, moisture, and free acidity, because these are most of the factors that contribute to the antibacterial nature of honey. We might be all aware that honey doesn't just have one antibacterial mechanisms, but rather utilizes multiple antibacterial mechanisms to achieve its exceptional and antibacterial nature. So we screened for this, and we found that different honeys also had a bit higher level of these phytochemicals and physicochemicals. I've highlighted the ones that had exceptionally high levels in red on the table. And of course, with when we tested for significance, there was a significant difference among the samples on all the parameters we tested for. Now, finally, we did a PCA biplot just to see the interaction of all these phytochemicals and the antibacterial nature of this honey. And with the grouping, the way the grouping happened on, first I'd like to mention that PC1 explained around 28.6% of the variance. And on the top side of the PCA, we could see that Kakamega honey, which is represented by the gray box, was quite effective against E. aphidicola, which is relates with the table that we got on our inhibition zones, the first table that I presented. Kakamega honey was the best against this E. aphidicola, Ewania aphidicola bacteria. The same trend is also seen on honey from Karura against Bacillus thuringiensis and Bartonelli apis. And also in the study, because this is an extensive study, I'm just presenting like one objective from the study. We also found out that in the classification of this honey, according to their antibacterial activity, some of the honey had superior antibacterial activity compared to the others. And this we could relate to their composition in terms of the physicochemical and phytochemical composition. And lastly, because I'm saying my time is almost up, we went further ahead to do Gcms analysis just to scan for the volatile profiles of these honeys. Now, the table is quite extensive, but I'm just presenting a part of it. So what we did was we did headspace sampling for the volatiles, and we also did BCM extracts of all this honey, and then we ran them in the GC, got our compounds. We analyzed these compounds against the inhibition zones of all the bacteria, and then we found compounds that had really significant p-values, and that is what we presented here. Now we went ahead to counter-check these compounds if they've been reported in literature to having antibacterial activity. And the one that have referenced on the reference line, we found that they've actually been documented to be part of many compounds that have antibacterial activity, and some have been tested individually. But according to our analysis, the compounds I present here all had an interaction or played a significant role to the antibacterial activity of this honey. So I think going forward, we would also recommend, maybe given a chance, to test all these compounds individually to find out that which ones exactly and by how much do they contribute to the antibacterial activity of these various honeys that we tested. Now that sums the end of my presentation. I hope I didn't take much time, and I welcome any question or suggestion on this work.
Okay, you can stop the share screen now.
Maybe before he stops, the last slide, so that people can understand the biogeography of where these honeys come from. If you can put,
let's put it again, Solo.
Yeah, yes. The last slide where you had the source of the honey. Yeah, here. So the Arabukococcoque, yes, Arabukococcoque is actually at the coast near, and it's usually quite warm. Baringo is towards the western side. Kakamega is near Lake Victoria, and there's a forest there, and it rains a lot. Karura forest is actually in Nairobi, Nairobi City. Kitui is towards the eastern part of Kenya, and also Taita Taveta. So you move from Kitui to Taita to Arabukococcoque towards the coast. And then from Nairobi, Karura, you move to the west of the country, you get to Baringo, and then Kakamega Forest. Thank you. Yes. Thank you. That is what I wanted the people to know, because I think in yesterday's presentation, there was the issue of the source of the place where the honey or the hive products come from may play a role in their antimicrobial properties. Thank you very much.
Yes, and I will also just like to add that in this sampling, this is not, we did various sample points, and then this is an average of the results we got. Like for Arabukococcoque, we took multiple samples from the area and then analyzed them and presented the average result.
Okay, very good, Solomon. And if you can share your presentation in our WhatsApp group. Are you a member in our WhatsApp group already?
I haven't been added yet, but I can share my contacts to be added. I would be glad.
It's better if you send us an email with this short request. And for the conference, we have had the application form with all details. And complete that one, and then we will connect you, then you can share. Very, very good. But I have also...
Thank you, Stefan. Thank you, Solo. I have a student in doctorate. The name is Solo Najwa. It's Solo. Huh? So when I see, because she is working with bee products and essential oils. Very, very good presentation. It is the best. I give you for poster. I give you the best. And
thank you very much.
Give you award because it is very interesting. Because here we have mentioning very good approach of epigenetics. Because you have bacteria from environmental and bacteria from bees, and there is some regulations, so epigenetic approaches. It's very, very interesting. This, and also we gives PCA bee plots. It's very interesting, this PCA, because it gives the antibacterial effect, which physical parameters and phytochemical parameters which we involved. The question is, what is the quantity of honey to be used for extraction of volatiles? We make this by hydrodistillation.
Yeah, we used headspace with the volatile. We used SPME, solid phase micro extraction. So we'll just put 50 ml of honey in a jar, cover it, and then insert the headspace on it. So we'll leave this for about 20 minutes, and then we'll extract the needle, the headspace, and then inject the GCMS. So the volatiles
it is
that
a few, it's a few quantity. It is not a good quantity for volatiles, because you're testing this volatiles also for antibacterial or only honey. Okay. So you
honey.
make
So
honey,
we wanted to
honey for antibacterials and volatiles for analysis. Yes, now I understand, because it is not easier to make volatiles from honey and to make antibacterial. Okay.
No, we tested
so
the honey.
You should make this in your presentation. The second step also the botanical origin of honey, because when I see like Wanja, it is you give the regional, the city of honey, but you should make for us the botanical, because I don't know this honey from Nigeria, the vernacular, the scientific name of plant to be buttoned by bees. You should give in the table the name of this floral, if it is monofloral or multifloral honey. Okay. So thank you, Solo. Congratulations. Thank you.
Thank you also for the insights. Thank you. I appreciate it.
If I may say something before you leave, who was your supervisor at the University of Nairobi? Number one. Number two, most of the time, is this a master's or a PhD? Because I know most students do a master's, and I hope somebody can offer you a PhD to continue with this work so that we can build it in Kenya. Thank you. Just let me know whether you have a PhD lined up somewhere.
No, I haven't gotten a PhD opportunity yet, but I'm looking forward to it. I'll be very glad if I get an opportunity to pursue this work further for my PhD, because I'm also in the final stages of my master's studies. And my supervisor at the University of Nairobi was Professor Onyari John and Dr. Geoffrey Bosire. Dr. Geoffrey Bosire is my main supervisor, being associated with Professor Onyari John. And at the ECPE is Dr. Michael Latoff, who was very instrumental guiding me through the work.
Thank you very much, Asante.
Good
work. Yes, sir.
Thank you.
I have also a question for Solomon. A big,
yes, please, doctor.
But very, very difficult one. Where did you learn so well English?
In Kenya here, our education system is quite good.
Excellent, excellent English. Congratulations.
Thank you very much.
So we must all come to Kenya.
Yeah, you could come. It's a beautiful country. You will tour around, and while you interact, you'll also get a good English.
Okay, then I have a big proposal.
Yes.
Let's start a competition. So my proposal is to make the first African conference on Api-Microbiology, first African for all the continent.
Yes.
And you must compete with Morocco, with Professor Badialousi, with Algeria, Professor Nariman Seguini, and the other people from these groups here.
Yeah.
What do you think? Do you have any chance to win?
I'm very confident in myself and my work. So they will really need to bring their A game to play here.
Okay. Yeah. Very good.
We can do it. I'm pretty sure we can do it.
Yeah. Thank you very much for the platform to share the work and also interact with fellow like-minded science enthusiasts. Thank you so much.
You're welcome.
Okay. Very good. I saw here in the chat somebody is asking us to connect to the WhatsApp group. So you have my email address. Anybody who is not in the WhatsApp group, please let me put here again my email address, and you just send me, or to Professor Nariman, you send your just your request if it's any problem. Okay, very good. Professor Nariman, anybody else with the short poster? I believe not anybody else. We did
we have a second. We have another poster, but I don't know if you had it. Correlation research regarding the total polyphenic content, antioxidant, and antibacterial activity of 3 types of Romanian honey. Octavia.
Okay.
This will be the last.
The last one. Okay, let me check. Let me check if we have it, but it's let's say here, Octavia. Okay, 2. Okay. Yes, I can send to the group by email, because it's a long one, and it's more text. It's not so visual, and maybe I will get from Octavia the PowerPoint with this presentation.
Okay, so we can close the poster session. It was the last one.
Yes, this one, and now the last part. Okay, let me close some here. Okay, now we have the last part is the open debate, and best recommendations of our experts on the use of bee products against pathogenic microorganisms. I would reformulate a bit the question to all of us here, because we are now a very good family and we'll be very good friends in the near future. We are already friends. So my big questions to all of you is, how can we convince the rest of the world that the bee products are good for as antimicrobials? What would be, in your opinion, the steps to do? And maybe you just we stop the communication and you write down on a piece of paper on the right of you. So first step should be inform this one, or do this one, and then we go through all these options. Let's just think a couple of minutes. I have my list here with what to do, but please make your list too. Okay. So who starts? And I write down all your suggestions. Then we make the list of suggestions, and then we make a good plan. Who wants to start? For example, I tell you just to encourage you. I said we must inform as many as possible microbiologists in other countries, in our own countries, about these scientific papers. Do you agree with such a proposal? Is it interesting for you?
Yes.
Yes. Okay. So I have another one. Inform the government about the bee products and the antibacterial power. Is it a good proposal?
Yes.
Okay. Any other proposal from you?
For me, the first step, especially for countries in Africa which have not done very much, is to carry out first, because currently the traditional knowledge is getting very well recognized and it's known. So if we can document or do an analysis of what is documented traditionally, then number two, we carry out formal epitherapy studies where we include microbiologists and the medical profession, even if it's on animals first, because at least it's easier to do research on cats and dogs than it is on human. That way, at least we will have something to show that it works. And I'm happy to see the Kenyans, a few Kenyans who are doing this just to show that microorganisms work. I mean, it works on microorganisms in the lab. So that's a starting step. Thank you.
Okay, very good proposals. Thank you very much, Wanja. Other ideas on how to convince the world that they should get rid of antibiotics? No more antibiotics. We want, or at least antibiotics plus the natural remedies.
You should give scientific evidence for this.
Yes.
Some articles, some original articles in each topics, and to make large distribution of this scientific evidence. in order to make validation and valorization of bee products for to use in microbiological aspects. Also to make a database from African and also others, but database of researcher which implicated in this area. It will be very good. And to make working group, because we have experimental data, clinical data, veterinary medicine. So it will be very interesting to make this organization. Perhaps for the first African conference, it will be interesting to make these strategies and this stratification and to have this nice presentation.
Very good.
I don't eat. I am so tired because we don't have lunch.
Yes,
So
yes.
we have to finish, Stefan. You have
Yes.
you give your lunch because you have 2 hours for the college.
Yeah, I took
Nariman
my habit.
also don't eat. Yes, Nariman.
Yes, it's the same thing. Yes.
Because Stefan he make Romanian time, not
Yes.
Algerian time and Moroccan time.
Yes.
Okay.
Hello, Prof.
Okay. Yes, Salomon.
Yes, I actually was thinking that we could have had some pharmaceutical companies join us on this kind of presentation. I think if we're thinking of moving beyond antibiotics, they are the ones who would understand the use and the importance of what we're doing. Maybe subsequently, when we're having this kind of discussions, we'll get them to come and join us. Maybe they will send some reps to come, some representatives who will come and look at what we're doing, because we cannot go beyond some of these points. In some of our areas, like in Africa, we have very strict drug agencies, food and drug agencies that monitor these things, and the processes are so difficult and tasking. So by the time you get through the lab, get through the processes of securing, maybe move and all of that, it becomes a very difficult task. So I'm thinking that in addition to the documentation that we're talking about, we also have to look at involving pharmaceutical companies to join us on this work. Thank you, Prof.
Okay. Very good idea. I write it down. Okay.
I think, Dr. Stefan, that's the most difficult part is to convince the doctors. Why doctors? Because as a fundamental researcher, we are doing research and we are making a lot of papers of the scientific evidence of the efficacy of bee products is well demonstrated. The population had the ability to accept this because in each country we have remedies from our grandmother and transmission ancestrale.
Yes.
So in all our country we treat with the bee products, we treat children, we treat burn, we treat lots of diseases, cough, we treat pneumonia, we treat we do it instantaneously because it's a part of our
ancestral knowledge.
Ancestral knowledge.
Yes.
So fundamental scientific, it's okay. Population, it's okay. But the person who treats and use medicine like antibiotic, anti-inflammatory drugs and other drugs are not convinced. We have to work on this part, I think.
Okay, very good. I will help you in this part because we convinced in Romania more than 500 doctors to join us in apitherapy. So there are ways to do it. Very, very good. It's very important. You are right, Professor Nariman. I'm thinking a doctor which has like 2,000, 3,000 patients. It's like the king of all these 3,000 people. And when the doctor says it's a good method, then
yes,
they do it. If they say no, then they will not do it. But yes, it's a good idea. There are several strategies. I will present later in our group about this. But let's write some other ideas. I see here Professor Jerry Wamae from Kenya. Do you want to say some ideas on how to convince the world?
Yes, thank you. Thank you very much. Those are very, very brilliant ideas. And I want to remind ourselves that even as we mention inclusivity of other stakeholders like the medics and the pharmacists, we should also be remembering that this is what we normally call the hostile stakeholders, because they'll be breathing fire and brimstone and trying to poke holes at the work that we are doing. So the earlier we include them in our discussions, the better. But be prepared that there will be some hostility, because I think you have mentioned that, Prof, that they have a large command of the patients, and they can undo the work we are doing if we don't involve them early enough. The second point I have on my notes is we should have our radar or our ears open to opportunities of influencing the policies in our country. And policy in agriculture, or policy to protect the beekeepers, policy in ministries of health, policy even in education curricula, because we need to pass the information that we have to the younger generations. And finally, we will not get very far if we forget to become bee activists. By bee activists, I mean we must be on the front line of protecting our bees, because bees are now threatened species in most part of the world because of climate change and all manner of abuse to the ecological zones where the bees thrive. Those are my 3 points. Thank you.
Very, very good, Prof. Jerry. I write it down everything. Thank you very much. Wanja, you have also some ideas?
Yes, thank you very much. I congratulate Jerry for what he's saying. One thing I would like to point out, in Kenya, we have what we call community forest associations, where the forestry department allows communities living within an area, as long as they have a formal registered organization, then they're allowed to keep their hives at the periphery of the forest. Number 2, the African Union actually in the last 5 years, possibly 5 years ago, organized to have African countries organize themselves into apiculture platforms. Like we have the apiculture platform of Kenya, which was the one which organized the World Bee Day in Kenya this year, and we had people from Africa exhibiting. And the reason why I'm bringing this up, in Ghana, I do believe some of you may know Professor Peter Kwapong, who was for a while a lecturer in the University of Cape Coast. And I do know he has a very strong, many years ago when we were doing the GEF, Global Pollination Project, which is about 7-10 years ago, he actually developed the the propolis tincture for teeth. So, and also some eye drops. And that time, I do not know, I didn't ask him how he did it, but I know currently his wife is a medical doctor. So I think one of the things we can do is tap his influence to find out how we can work now, starting with Ghana, because there is a link there, how to make sure that the bee products can be studied and accepted. Because once it is accepted one place, then it branches out through the African Union. Asante. Thank you.
Okay, thank you very much. Yes. Braimok from Nigeria. Yes, if you can activate your microphone.
Yes, Doctor. Yeah, good afternoon, everybody. If what we are discussing is the acceptability worldwide acceptability of bee propolis products, beehive products for utilization of modern medicine and the acceptability. If we use the Nigerian scenario, like somebody rightly said from Kenya, there is always a regulatory body, but they don't have keen knowledge about beekeeping or apitherapy. So I think I would suggest that there should be a compilation of comprehensive analytical qualities and the collation of all these beehive products, so that in combination or in recognition with geopolitical presentations that we are having. Let's put it this way, like in Nigeria now, we should be able to talk about like Professor Badia said, we need to talk about the etiology of, to be able to now ascertain which kind of botanical stuff within our area and geographical zone that they are tapping it from, the nectars that are being converted to honey. You see, we don't need to involve, if we are trying to create unnecessary, unhealthy competition when we are going in with the so-called the pharmaceuticals. You know, presently they make a lot of hell of money. Like I told you some other time when my younger sister had colorectal cancer, which I was able to use with the combination of bee venom and propolis, combined with the radiotherapy and the little operation that was done. And then she's ill and healthy, free of it now. Okay. Very good. So if what we can do is let us do a comprehensive compilation of analytical properties of all the beehive products within our jurisdiction. Then we will now bring it to the center table for open analysis. Then we will recombine it together now to move ahead. You see, when we create a unique product, they will look for our product. Like one professor from Kenya rightly said now, she is vending for forever living products. Forever living product needs nobody's assistance. So our group can make something nice, then for presentation in vivo. Thank you.
Okay. Thank you very much, Pramod. Okay. Yes, we can just find our ways. Yes.
When we organized in Fez 10 years ago the conference, now it is a big difference because doctors are coming to the conference and use bee products for healing in intensive care with COVID. They use propolis honey because my daughter, she is professor of anesthesia and intensive care. So now she is working with propolis, with honey in the hospital. Very, very interesting data. But you should make some scientific papers to give to the doctor and to make some conferences for doctors. And after they could try this. Also for your idea to make African conference, it is very good because I had in Api-Mondia, I am in Apitherapy, Api-Mondia Council with Christina Matesco, and I have discussed with the president of African section for Api-Mondia, and he agreed to organize a conference for African countries. And I discussed this with Christina Matesco, but with COVID, there is a problem. So perhaps in Api-Mondia, Turkey, we could organize this. But now I would like to have the email address of African colleagues which participate in this conference, like Wahid, like Wanja, and the others. They have a beautiful boucle d'oreille. Come on, I did boucle d'oreille. It's very nice. Your yes, I would like to have like this. Very, very nice. So Stefan could organize this to have the list of email from, and also Nariman.
Yes.
Have this discussion because you're the last for this discussion, for this network. It will be very interesting, yes, to combine this. Okay.
Okay. Very, very, very good. A lot of good ideas. And before we close, not to forget, Prof. Nariman, to make the photo group with the people which are still here with us. They can open their cameras. And yes, let's try to make some conclusion of the conference, Prof. Nariman.
Yes, with great pleasure, Dr. Stefan.
Okay. Okay, so yes, okay, let's please open your cameras. Everybody open the cameras, because we can do print screen. So yes, everybody please open the cameras. Yes, Lydia, wonderful. Okay.
African photo with Stefan and African European photo.
Yes. About this idea with the group, it's we can make in WhatsApp a group, Api-Therapy Africa. Yes. WhatsApp group, Api-Therapy Africa. And then it can be different specialties. And then we'll make, of course, Api-Therapy Asia with Professor Aldo Sabir.
Because I have a Pharmacology Africa, because we have organized a big in Copenhagen 10 years ago with International Union of Pharmacology, and we make with the ambassador of of Kenya, perhaps, I don't of South Africa in Denmark, and we make this networking pharmacology for Africa. So I will send you all the details. It will be very
good. Very good. Okay, I see also Tariq, Noemi Martin. Hola, Noemi. ¿Cómo estás? Okay. And somebody more with photos here. So it's the other people are shy. Mirela, open the camera. Marie-Jeanne, Timothy, Hans Jungblut, Tibi, deschide camera dacă ești pe aproape. Okay. And I see also Ruta Kislaite from Lithuania. How is Lithuania, Ruta?
It's very good. It's very nice, and everyone welcome to see and welcome.
Yes, Lithuania organized our second Federation Congress in 2016. Excellent speakers and excellent researchers in Lithuania. Okay, I see also Angari and Uvima Beata. Hello, Beata. Beata is very active in our groups. She's from Rwanda. Okay, very good. Other people with open camera. Okay, then yes, who is Samsung? Samsung, now open. What is your name, Samsung? Can you open your microphone and tell us your name and country? Yes. Okay, can you open the microphone? Samsung? Okay. So next time, please put your name near the image when we are here. Okay, let's prepare for your best smile, and then you can press on your own. You have this kind of keyboard, and you know there is a button which says print screen, and when you put the press on this one, print screen, you press. You get the photo of the screen. Okay, so 1, 2, 3. Okay, I made one print screen. Let's transfer. Did you do your print screen with the photos?
How to make it? I don't have a screen.
I don't have an idea.
I have Macintosh, but we don't have screen.
Oh, you don't have print screen. Okay.
Can you send the screenshot to our WhatsApp group?
Yes, we put a lot of photos in the WhatsApp group also.
So send it to our WhatsApp, yes, because we don't have share screen. We don't have this.
You have for sure, but it's somewhere you need to ask a specialist in Macintosh, because they have for sure this one. Okay. Oh yes, we have. It's a good, nice photo from all of you here present. Okay. Okay. So we are very, very happy. Prof. Narimane, what are your thoughts now to the end of the conference?
Send us the photo, please. Stefan, send us by
yes,
WhatsApp.
by Api-Microbiology. Okay, yeah. I'll send it. Yes, okay. Let's hear Prof. Narimane.
I'm very happy because I think we succeed to gather all these wonderful scientists and beekeepers and person loving practicing apitherapy for the first time, in particular in this topic, Api-Microbiology. So it was plenty of information, lots of knowledge, lots of exchange, new idea, maybe new collaboration, new projects, and I hope we will continue to do this in the future.
Yes, excellent, excellent. And maybe it's a good idea that each of our main speakers will say also a few words. Professor Sibel, a few words from you.
Thank you very much. Really, thank you very much to you and to Neriman. I congratulate you. The Congress are very useful for us. Thank you very much.
Okay, welcome, welcome, Sibel.
Welcome.
Some words from Badia, our wonderful friend.
Yes, congratulations for this nice conference, because microbiology, it's the actual thematics. And we have Nariman, bravo. Bravo, very excellent. It's a good synergy with Nariman and Stefan. Stefan is the capture in Morocco, Algeria, Turkey with Cecil. So it is very, very good idea to work as one community, because you're scientists and you should promote natural products for health, for quality of life, for rural population, for circular economy. So there is many thematics to be solved by this. So congratulations, and I am very happy to be part in this working group. And for Africa also, it will be very, very interesting to make and to manage some mini symposium with this floral diversity of honey. Why to start with all honey from African, from Turkey, from Europe, and to make it the best, to make a cocktail of these bee products, and to make a formulation. Why not a formulation with biomarkers from Morocco, Algeria, Turkey, from all, and to have a patent for this? Why not? It will be very, very interesting to have economical interest and also business win-win. It will be very interesting. Yes. And congratulations for this nice conference.
Thank you very much, Professor Giussi. Thank you. Dr. Azevedo, your last words for our family?
Actually, it was a very great privilege to be part of this group. But actually, I'm novice in app therapy. Oh. I'm a note one in my medical experience, but in apitherapy, no. So I'm learning more and more. So thank you so much for everyone that helped me in this conference to learn more about this wonderful art, apitherapy. Thank you.
Thank you very much, Dr. Azevedo. We are all learning every day. It's indeed, we learn all our life. Thank you very much. Prof. Ardo Sabir from Indonesia, a few words from you. It must be late night in Indonesia now.
Yes, it's the local time. This in Makassar is 11
p.m.
Okay. Yes. Yes. Almost midnight here. Thank you very much for the organizing committee, this conference, especially for Dr. Stefan and Dr. Nariman who arranged this conference. I'm very happy can join in this conference. I hope the network is will continue in other conference, and it's very interesting when many speakers in Africa join in this conference and present very interesting research. Their research is in this conference. It is the very interesting for me to get many new knowledge from the presenter from Africa. It's very wonderful. Thank you, Dr. Stefan.
Okay, thank you too, Prof. Ardo. Ardo Sabir, he is very, very active in Indonesia. Thank you again, Professor Sabir. And also, Andre, if you can, Andres Buka, if you can open your camera, if you are here, to tell us a few words. If not, let's give a bit of time to Andre. Ipav, Solomon Ipav, a few words from you. Come closer to the microphone. Yes, and open your microphone too. Yes.
Thank you, Prof. Like I said yesterday, I can put a face to the several names I've cited in the course of my research on propolis. I'm so excited, So I would want to stay. I want to learn more and want to grow on it. So I'm hoping that this is just the beginning of days for us. Thank you very much. God bless you.
Yes. Very nice words, Solomon. And yes. And Professor Jerry Vamae, a few words.
Thank you very much, Prof. And thank you for asking me to make my summary comments. I actually had put it on the chat box and had started by saying that I congratulate the organizers, including yourself and Professor Nalimane and all the others, the presenters and the participants. I consider myself the new kid on the block or the newcomer, Johnny come late, because this is the first time I'm attending a conference that is talking about the bee and the bee products. The only close thing to what I have always done in my life is the mention of the bacteria, the protozoans, and the helminths. So for that part, it made me feel that I'm among a community of people who are doing similar things to what I do. But I must say that I have learned a lot. I'm very, very happy and very thankful to Anja for inviting me. And I look forward to walking the long journey ahead of us together with this warm and loving group of who are passionate about their work.
Yes.
Thank you.
Thank you very much too. Sibel?
I want to add something, Stefan. I'm biotechnologist and I study on especially bioactivity of honeybee products. Also in vivo experiments on experimental animals. Therefore, I'm ready for collaborative projects and works. My email I can write here. I'm ready always.
For international cooperation. Wonderful. Very good. We are international bees flying everywhere. Yes, wonderful, wonderful. Anybody else who wants to say a few words? Okay. So the general idea that is we will continue the work in our WhatsApp group. We'll make many working groups. We will make with Prof. Narimane, we'll make the book of abstracts. And maybe also we'll collect all the PowerPoints and the PDFs of all the presentations and we'll put in our websites. And then in the next coming days, I'll put all the videos of these registrations, the recordings in YouTube. So you can also download from there. But also, why not? Maybe it's faster. One video, like a couple of hours, it's sometimes 1 gigabyte. But I can send it to you. If you send me just an email, I say, Stefan, please send us the video from this morning or this afternoon, or with this speaker or this speaker. And there is now a system is better than WeTransfer.com. It's another one. I don't remember which. We can send larger data.
Yes.
And then we can send you just the videos as we have them now. Of course, I'm really sorry. It were some technical problems from time to time, some stopping in the recordings. It's always some such. It's my mistake. It's sorry. So every critics, please come on me and please forgive me and for some mistakes. Okay, so yes, I see here it's a registration form. We have EPUB we put it in the registration part. So just send us an email, because in this registration form for the group, there are more details which we can get from you, like address, email, phone, what are you doing? And then it's better to make the database, like Prof. Badianu said, to have a database with all of us. Yes. Okay. So from my point of view, so I'm really happy. It was just an idea. I saw Prof. Narimane a couple of months ago presenting, and I asked her, can we do an Api-Microbiology Conference? And she responded immediately and said, yes, we can do it. And we worked in the last months and weeks for this conference. You saw it was very simple. No sponsors, no money, no these logos of companies, and everything was free of charge, and no complication, like send us a pre-recorded video and so on and so on. Everything simple. But of course, this allows some mistakes, but we can correct them. And the most beautiful part is that we will continue to communicate in our WhatsApp group. So again, from me, thank you very much to all of you. Thank you, Professor Nariman, for helping me with this conference. Thank you all the speakers who came with their heart and their knowledge, their mind. And let's continue to work in our family, in our big Api therapy and bee products family. Thank you very much.
Thank you, Stefan and Nariman. You're a big boss. You're doing a very good job and for humanity. So Allah gives you for good health and prosperity, all of us, inshallah, to be in to help population, to help for to cure pathologies with natural products. So don't forget our photo by WhatsApp, Stefan.
Yes.
Thank you.
Okay.
Thank you, Professor Badia, for your nice word.
No, it is my pleasure, because you are doing a very hard work. Like Stefan told us, without sponsor, without registration fees, because to have free of charge all these conferences, هذه صدقة جارية. تحسب لنا. It is helpful to make translation. It is a good thing without receiving anything, without receiving money, but we do this with great heart. And with that, inshallah, Allah give us give us a very good health and prosperity and life with all positive attractions, inshallah.
Inshallah.
Yes. Wonderful. Thank you all.
Thank you, Professor Stefan. It was very kind to share with us all those presentations. Very instructive. Yeah, be blessed.
Okay, thank you very much.
Thank you.
We heard the future. The future is there.
Thank you very much.
Thank you.
Thank you.
Okay.
Bye-bye.
Stefan, you have the témoignage.
Bye, everyone.
Témoignage of all these authors. Témoignage.
See you later.
Bye.
Bye.
See you soon.
Bye. Thank you so much.
Bye.
Bye.